Hi everyone. I've decided to keep cell injury in three parts. So three parts and again, if you going through recorded lectures, there is a recorded platform also, as all of you know, on PrepLadder. But recorded platform is more for NEET PG and FMG students, basically MCQ point of view only. So abhi you might feel that ma'am, in recorded it was cell injury was 5 hours, but in this batch you have taken cell injury for 6 hours or 7 hours. Why have you done that? Because I am not teaching you only point of words. I am teaching you short note, long question. I'm teaching you full concept from zero. From 0 to 100 I am going to build you up. So thoda sa 1 hour extra with doubt solving lagega. All the orientation part is done. After this, every class we won't have to waste this time. Every class we can start. So I have divided cell injury into three parts, and each class is going to be roughly 2.5 hours of duration. But obviously I'm not going to torture you. At any point you feel that ma'am, it is toxic, it is too much, can we take 10 minutes next class? We are all flexible. So first thing, you have to stop being very scared of me. Just in case you are, you have to be as if you are studying with a friend. You do that in the hostel. You pick up a book and you say that, okay, you read one page and teach me, I will read one page and teach you. That is the kind of the rapport that I want you to have with me, where you are not scared of asking me any doubt. What is a cell bhi पूछना है ना, तो पूछ लेना. Don't be scared, because now you leave one doubt and that is going to bother you when you go later on. And later on internship में जाके किसी से नहीं पूछ पाओगे what is a cell. Then people will say, oh, you don't even know that much. So now is the time. Ask the dumbest of doubts. You might feel that, oh, what am I asking? Ma'am will laugh. It's okay, we will laugh together. But you ask your doubts, clear your doubts. Okay, finally good to go. We are starting with the first part of cell injury. So of course we have to start with introduction and necrosis, cell death. Usse pehle, when I say cell, I am assuming everyone knows basic cell, and this is not what you have to write. Ye bas sun lo. This is a cell. And what is the cell having on the outside? Every cell has a membrane. Let me ask you, your first year answers have to come. Sahi, galat, I don't care, but you have to write answers. Membrane, what is it made up of? It is always made up of phospholipid. Do we remember that from biochemistry? Next, what do you have in the center? In the center, we have something called as a nucleus. Nucleus is all the DNA and all the parents' chromosomes that we have received. And what do you have over here? What is this pink area known as in the cell? Anyone? The pink area is referred to as the cytoplasm. So what does the cytoplasm have? The cytoplasm has proteins. So I will repeat it. Outermost is the membrane, which has phospholipid. Then the pink color is the cytoplasm, which has proteins. And the blue color is the nucleus. And nucleus has what? All our DNA, like parents, father, mother, DNA, chromosomes is there. Why am I telling you something so basic? Kahan kaam aayega? Because the topic is not cell. The topic is cell injury. I will teach you cell injury for 1 hour now, but that cell injury, when I say cell is being broken, cell is being injured, you will ask me which part of cell is being injured, and everywhere 3 parts of the cell will be injured. So tell me, what will be injured? Membrane, matlab phospholipid will be injured. Second, cytoplasm will be injured, which means proteins will be injured. And third, the nucleus will be gone. This means the DNA will be gone. So tell me now, what are the 3 backbones of a cell? Phospholipid, protein and DNA. If I say cell injury, what are the 3 things you will break? Phospholipid, protein and DNA. Basic समझ आ गया? If you understand this, the next 1 hour of your life is settled. यही 3 चीजें बार you have to break. Phospholipid, protein and DNA. Let us start. Now we start with cell injury. So the first question will be, why does cell injury occur? Which is the most common cause of cell injury? So whenever, now as I said, I also have to guide you about answer writing in second prof. So if you get, say, reversible cell injury, doesn't mean you only write the short note of reversible cell injury. You always have a header. So let me first teach you the art of writing short notes. Short notes में हमेशा क्या होगा? There will be a short introduction which you will give of 2 to 3 lines. Then comes the main body, which is whatever has been asked by the examiner, and then in the end you will give a summary. That summary should have just 5 bullet points. That is how I used to write my answers, and as someone who has followed this all through her MBBS and has always got a distinction with this formula of writing exams, I can vouch for it. Knowledge is of course important, but how you give that knowledge in the answer sheet is very important. So please remember that you first give, say for example, koi bhi question aaya on cell injury, the first sentence of cell injury should be, cell injury involves breakage of phospholipid, proteins and DNA. Cell injuries of 2 types, reversible, irreversible. After that, जो भी question में पूछा reversible cell injury वो लिखो. End में only 5, you can say, short sentences, that even if the examiner is not in a mood of reading this, examiner should know that okay, even by reading the 5 summary points of this student, I will get a hang of whether isko aata hai ya nahi. You have to write every short note like that, and you will see automatically your marks go up. So whenever a question comes on cell injury, these are few lines which you will write in your introduction. So let me ask you, why does cell injury occur? What is the most common cause of cell injury? And that is going to be hypoxia. Of course, there are so many causes. I mean, even if I don't ask you, normal socho, can this air pollution, these days the AQI after Diwali is so bad, can this air pollution cause cell injury? Of course. Can, if by chance your water is polluted, you can have cell injury. Can pesticides, insecticides, chemicals, toxins, poisons, do they cause cell injury? Of course. But the most common cause is hypoxia. What is hypoxia? It is a decrease in the oxygen at the tissue level. That is a definition we used to study in school days also. What is hypoxia? Decrease in oxygen at tissue level. So your next question will be, ठीक है, oxygen कम होगा तो obviously ना cell injury will occur. But what is the cause of hypoxia? What is the most common cause of hypoxia? And that is going to be ischemia. Ischemia basically means what? That the blood supply, this is a blood vessel that I have made, and the blood supply has been cut off. Now these kind of diagrams also I used to draw in my university exam sheet, because if you write ischemia and then you write the blood supply is cut off, chances that the examiner will read it are less. But if you write ischemia, you write blood supply is cut off, and you make a small little diagram, suddenly the examiner's eyes go towards that automatically. Basic human nature, the eyes will go towards the diagram and a flowchart first. Everyone who's attending class needs to answer, what is the most common cause of cell injury? It is going to be hypoxia. The most common cause of hypoxia is going to be because the blood supply is cut off, that is ischemia. आगे बढ़ते हैं. Let's take a patient. Don't think pathology will always, ma'am will keep telling us about things to mug up and boring things. At every point we will try, we correlate it with a patient. So just imagine there is a patient, his oxygen level went down, hypoxia happened. Right now, let's assume because he had a problem in his blood supply. Okay, he has atherosclerosis or some blood clot. So because of a problem in blood supply, his oxygen went down. Which is the cell most sensitive? Which cell do you think will say, okay, hypoxia ho raha hai, no oxygen, I give up? The cell most sensitive to hypoxia is going to be neurons. They asked me cells, so I wrote neurons. If they would have asked me organ, neurons are present in the brain. Do you know that brain can tolerate only 3 to 5 minutes of hypoxia? So can you now tell me a patient, brain में hypoxia, what situation is that known as? You must have seen, even without being into MBBS, you must have heard of stroke. A patient of, very good, a patient of stroke में क्या होता है? There's some blood clot in the blood vessels of the brain. Imagine in the brain some blood clot gets stuck. Obviously the oxygen supply will be gone. Oxygen supply gone, this means oxygen gone. The hypoxia will happen. The brain will give up in how many minutes? 3 to 5 minutes cell injury starts. Why do they say you have a patient of stroke, rush him to the hospital? It's a medical emergency. Make him or her reach the hospital as soon as possible, because brain is very sensitive. Brain will start dying within 3 to 5 minutes. So cell most sensitive is neurons or brain. Similarly, cell most resistant means 5 minutes of hypoxia, this cell will survive. 10 minutes of hypoxia, 20 minutes, 30 minutes, 40 minutes, 60 minutes, 1 hour of oxygen being low, this cell will still survive, and the name of that cell is a fibroblast. Now, obviously these are 4 MCQs, but this is also very important, because when you get a short note, I told you na that in the beginning you should write 2 sentences which is an introduction to the topic. Whatever short note you get of cell injury, at least write the most common cause of cell injury is hypoxia, and the most common cause of hypoxia is ischemia. Then you come to the main body of whatever has been asked, and what will be asked. So this is something you don't have to mug up. This is common sense. Imagine there is some injury. Chalo, abhi we are doing the injury of hypoxia all the time. So let us consider hypoxia, that is oxygen concentration went down. Do you think your cell is immediately going to get injured, dead, oxygen drop hua? dead. We would have died within what, seconds of our birth. Imagine you go to some Himalayas or high altitude, you have gone to Leh Ladakh, you have gone to some high altitude for trekking. Obviously the oxygen levels will go down over there. Will you die on the spot? Of course not. What does your body first try to do? Your body first tries to adapt. When you go to a high altitude or whatever reason, if your oxygen goes down, your body will adapt. But if the body cannot adapt, if adaptation fails, then cell injury happens. And which kind of cell injury? Reversible. Common sense laga. What is reversible cell injury? Now tell me. Oxygen went low, your body said, never mind, I will adapt. I will take care of you. But if the body cannot adapt, then cell injury occurs. Reversible. Reversible means if you give him treatment, you take him to the hospital timely, everything will be back to normal. Reversible means ठीक हो जाएगा, all back to normal. But if you don't take him to the hospital, if the injury continues, after some time your body will say, I give up. Now the injury is irreversible. Now you give treatment, you don't give treatment, now it is gone. The cell has almost died. Irreversible cell injury will result in cell death. This is written as a big paragraph in Robbins. So common sense na that it is going to scare you. We have made it into a flow chart which will make it easier for you to learn. So everyone repeat with me, and the purpose of my class is every slide I repeat 2 times. First I teach you, then I repeat. Not for myself, for you guys. So that I want when you go back, this class you don't have to see again. You are directly jumping onto Robbins and you're reading it and you're taking out extra points from there. You don't have to come back to this class because ye class साथ के साथ रट्टा लगा दो. This class you have to learn with me, okay? So when injury happens, there is going to be adaptation. Adaptation fail hua, what is the injury? First, reversible. If it continues, it is irreversible cell injury. After that, the cell is going to die. These are the 3 topics of today's lecture. We will first study reversible cell injury, then irreversible cell injury, and then cell death. Yahi padhna hai hame in today's lecture. So let us get going. First, I'm starting with reversible cell injury. Everyone, are you with me up till now? I hope there's no problem and we are good to go. Reversible cell injury means that whatever will happen is reversible. Treatment mil gaya, patient will be fine. So let us start. When I say reversible, what did I tell you is the most common cause of cell injury? It is going to be hypoxia. So we have hypoxia over here. Excellent. Now tell me something that as soon as oxygen goes down, which is the first part of your body, not neurons, I'm saying which is the first part of your body, organelle, which gives up, and that is going to be mitochondria dysfunction. The mitochondria says, I give up. Mitochondrial dysfunction, because mitochondria had to do all of that. Na? In biochemistry, you must have learned oxidative phosphorylation, ATP generation, and for all of that, mitochondria needed oxygen. Now oxygen is not there, so mitochondria will say, I'm not doing any work. What does mitochondria make? Go back to school, 12 years of your school life, when you have forgotten everything. The only thing that you remember from school life is what? Mitochondria is the powerhouse of the cell. That's all that we remember after so many years of studies. Now the mitochondria, powerhouse of the cell, is giving up. It says, I'm not working. There's no oxygen. I'm on strike. As soon as mitochondria says that, very good, there is a decrease in ATP production. Now you are in shortage of energy. Your body does not have energy. Big time problem. So now this is what you're writing as a short note, but हमें MCQs भी साथ साथ खत्म करना. I'm preparing you for university exam plus NEET PG, FMG, whatever paper. Everything is going hand in hand. There is nothing that ma'am should I read something else for NEET or for university. सब इसी में सब cover होगा. So if you get an MCQ that which is the first change of cell injury. So please remember, the first change of cell injury is going to be a problem in the mitochondria. Mitochondrial dysfunction is the first change of cell injury, and because of that ATP production goes down. Now tell me, if ATP production goes down, 3 things are going to get affected. You don't have to mug it up. Tell me you're talking about cell injury. First thing that I taught you, in a cell, if you are injuring it, which are the 3 things that you will injure? I will injure the membrane, that is phospholipid. I will injure the proteins. I will injure the DNA. Do you remember it? Phospholipid, protein, DNA. Bus. ATP goes down and phospholipid, protein and DNA are affected. So let me start with number 1. Have you all in physiology? Abhi to you're just out of first year. Do you remember that pump? Sodium, potassium, ATPase pump. Do you think that pump is going to work? So I'm starting with the first thing on a fresh page. There is going to be failure. Of which pump? Because ma'am ATP is not there, so there is going to be failure of sodium potassium ATPase pump. So now, because you are fresh out of physiology, let's do a pact. You teach me physiology and then I will teach you pathology. First, you teach me physiology means that if I draw a normal cell over here, let's assume this is a normal cell. What goes in, what goes out, how many sodium in out, how many potassium in out. So sodium, potassium, ATPase pump. I don't know how you guys learned it in physiology. In our time, we used to learn it by the mnemonic of Nokia. Nokia basically meant A, of course, was going to be for ATPase. Sodium is out and potassium is in. That is how we used to learn. So Nokia meant that sodium tends to go out and potassium tends to come in. So please note, we have written this. 3 sodium are going to go out. 3 sodium molecules go out and 2 potassium molecules are going to come in. Here we have 2 in. Is this very good? 3 Na out and 2 potassium in. And what will this require? This will require ATP. So kya bana? Sodium potassium ATPase pump. But now I'm saying ATP is not there. Will this pump work? This pump will not work. Now it goes into failure. Very good. Since you, very good Dr. Om, told us about normal, so now I will teach all of you about failure. Failure is nothing but Nokia ka ulta. Opposite of Nokia. So if 3 sodium were initially going out, now 3 sodium will come in. Bilkul ulta. Now it's going to be 1, 2, 3. 3 sodium are going to come in and 2 potassium are going to go out. Now I want you to do simple mathematics. Because of failure, where do you have more of ions? You have 3 sodium in, only 2 out. So where do we have more of ions? Inside the cell or outside the cell? Inside the cell, which means basic physiology in school days you used to study, chemistry ka experiment hota tha. If there are more ions inside, where will water go? Water will always go towards it. So where do you think? Very good. I can see that water will start running. Okay, oh, there are more ions inside. Let me run towards it. This is going to result in water influx. And now let's test your common sense. If this is a cell and water is going in, what will happen to the size of the cell? Obviously, the cell is going to swell up like a water balloon. There is going to be cellular swelling. And why has, just like a water balloon, the cell will keep on becoming big, big, big. Cellular swelling. Why has this happened? It has happened because of water. So can I also call it hydropic change? Very good. Hydropic change. Amazing. So we've got Dr. Shreya, Dr. Om over here. I'm happy that you guys are understanding. So water goes in, वो बड़ा सा water balloon बन गया. Now I'll ask you, I'm preparing you for MCQs. तो MCQ क्या बनता है यहाँ पे? Which is the first morphological change of cell injury? Now you will say, ma'am, right now you taught us the same question. Right now you are saying morphological change of cell injury is hydropic change. The first morphological change is hydropic change. Exactly 1 minute ago, I asked you, what is the first change of cell injury? दोनों में difference देख रहे हो? The first change of cell injury was a problem in mitochondria. But the first morphological change of cell injury is going to be this swelling or hydropic change. The difference in both is, over here I've added the word morphological. What is morphology? Pathology mein, what is morphology? Morphology means size, shape, appearance. When I say the cell's morphology, so I mean to say what is the size of the cell, what is the shape of the cell, dekhne mein kaisa hai, how does the cell look like? Looks is morphology. So over here I'm talking about the size of the cell. That is why I'm talking about morphology of the cell. Earlier I had only asked you what is the first change of cell injury. First change is mitochondrial dysfunction. First morphological change is cellular swelling. Okay, that's not it. This is only the first thing that has happened. Water is going in. What else will happen apart from cellular swelling? Do you agree that water will go inside? एक तो full cell will become like a big water balloon, cellular swelling. Organelles will also start getting up water. Endoplasmic reticulum will also start swelling. There is endoplasmic reticulum swelling. Number 3, more water goes inside. See, initially the cell was like this. This is the cell. I am saying water is going inside. This cell says, okay, what should I do? Like just like a water balloon. I'm sure it's reminding you of Holi. On Holi, you fill water balloons. If you keep the water balloon attached to the water source or the tap, the balloon will keep getting bigger. Finally, at one point it will burst, but till wherever it can keep the water, the balloon will keep on getting bigger. So immediately the cell will not burst. Balloon doesn't burst in 1 second. First, it tries to become as expansile as possible. So the cell says, chalo, let me try and become big in size and let me get a lot of water inside me. What has the cell made? Cell has made something called cytoplasmic blebs. Can we all see that outpouching? ऐसा cell ने क्यों बनाया? Why has the cell made outpouchings? Because the cell says, okay, never mind, let me accommodate more and more of water as this person wants, so let me make blebs. But then you will say that, fine ma'am, in this process one more thing happened. The cell also had chota, all cells have these small hair like things. Anyone who knows what are these? Every cell on their surface, like on your skin you have chota hair. Similarly, every cell also has chota hair, and those hair are known as microvilli. Those hair are known as microvilli. But just imagine if the cell is becoming so stretched out. If we end up stretching your skin so much, will these small hair be visible or will they flatten out? If I stretch the cell big time, the hair, the microvilli will flatten out. Can I say that there is a loss of microvilli? Everyone, are you with me till now? Yes or no? Everything happening over here is failure of sodium potassium ATPase pump. Over here, a lot of water is going inside. So the cell is becoming big over here. Swelling happening, endoplasmic reticulum also becoming big, the cell is trying to accommodate, so blebs are forming, the hair are becoming flat like Shreya said, so loss of microvilli. Finally the cell says, bas, I give up. Now you are filling more water, now like a water balloon, I will burst open. And the final stage that happens is going to be the bursting, and that is known as myelin figures. So let me show you the picture of what is myelin figures. This is a photo of myelin figures. Anyone who can let me know that what color is this? Of course black and white, but why ma'am? Pathology, you introduce pathology to us saying it is the world of pink and blue, and now you are saying it is the world of black and white. Why is this black and white? Because when I say pathology is pink and blue, over there I am teaching you light microscope. Have you guys gone to the pathology lab as of now? Have you switched on the microscope? Have you tried to adjust your two eyes, binocular vision? Kara, I know you must have not been very successful, but try bhi kara to function with a microscope. That is good enough. So the microscope that you have in your hospital, your medical college, is a light microscope. That gives all the colorful photos. When they give this black and white photo, please remember, if you get a black and white photo in the exam, they have not used that microscope. They have used electron microscope. Most of the medical colleges don't have electron microscope because it's very advanced, very expensive, and hoga bhi to undergrad level pe they don't use it at all. They only use it for postgraduates. So electron microscope uses electrons, and that is why the photo that you get is black and white. So this is what kind of photo? It's a black and white photo. They have used electron microscope, and electrons, you think what will be able to see better? Light, through light can you see every detail, or electrons will be able to see every detail? Common sense tells me that light will tell me all superficial things, but electrons will go deep inside, and electron microscope will be able to tell me details, and that is what it has shown me. Can we all, if we can zoom into it, I'm going to zoom in every photo to you because you can't do that in Robbins, of course. So this is something where you can zoom in and see with me. Can you see that there are layers that are formed? This is what is formed, and whenever in pathology you get multiple layers, it is going to look like an onion peel. So myelin figures, how does myelin figure appear? It is going to show concentric lamellations. Concentric lamellation means that it is going to show multiple layers one after the other, and this concentric lamellation is referred to as onion skinning. This concentric lamellation is referred to as onion skinning. Anywhere in pathology I say lots of concentric round thing, all that goal will be known as onion skinning. So what have you learned? Number one, if you want to see, you will have to use electron microscope. Number two, it looks round and round like onion skinning. Now comes question number 3. What is it? Hota kya hai? So do you remember that over here in this, finally water was coming. There was a time when cell says burst. Can't have more water. This is too much water. Water balloon will burst. You tell me. Membrane tha. This is cell membrane. It has burst. What does the cell membrane have? Phospholipid. If the cell membrane bursts, what is this depositing? This is nothing but phospholipid. So myelin figures are made up of what? They are made up of phospholipids. Please remember, myelin figures are going to be made up of phospholipids plus a little bit of calcium also comes in them. I said little bit of calcium. This means that in your theory exam you write myelin figures are made up predominantly of phospholipids. Majority of it is going to be phospholipid, and a minor amount of calcium is also going to be present, which will come and sit on it. So now you must be wondering, what are these concentric lines? Ye kya cheez hai? This is all the phospholipids. So tell me guys, do you all remember the first part? Don't forget the first 1 minute of this lecture. You have to break 3 things in a cell. Have I broken the membrane? Now you understand why am I teaching you reversible cell injury. What have you broken? You have broken the membrane or the phospholipid. What have you made? You have made myelin figures. So now coming back to my flow chart, this is what I was doing. I was teaching you reversible cell injury. Abhi tak ka, I told you, I will do 2 slides, then I will repeat. So now 15 seconds, only listen to the summary till here. I am talking about reversible cell injury. In reversible cell injury, most common cause hypoxia. As soon as hypoxia occurs, which is the organelle that stops functioning? Mitochondria. What will not form? ATP is not going to form. Because of that, what is the first problem that happens? There is failure of the pump. That is failure of sodium potassium ATPase pump. And which figures are formed? Come on, fill in the blanks. Because of the failure of the sodium potassium ATPase pump, there is formation of myelin figures. What are myelin figures made up of? Predominantly, they are made up of phospholipids and they have a little bit of calcium. Membrane toot gaya. What do you have to break next? The second thing that I want to break is going to be 2 things left. My membrane gone. Now you have to break the proteins and the DNA. So let's do the second thing. The second thing you will tell me before I start. You tell me from biochemistry. Oxygen to hai nahi, no oxygen in the body. Which glycolysis will occur? Aerobic glycolysis will occur or anaerobic glycolysis will occur. Even if you've not read biochemistry, common sense tells me that because of a decrease in oxygen, the second problem that is going to occur is that there is anaerobic glycolysis. Now you can help me a little that because of anaerobic glycolysis, which is the byproduct formed in anaerobic glycolysis? You have pyruvic acid, lactic acid. Yes, very good. So you have pyruvic acid or pyruvate, or you have lactic acid. Overall, I'm not taking you into biochemistry, don't worry. Overall, can I say the acidic pH has occurred in the body because of pyruvic acid, lactic acid? The acidic pH has gone very, very low. It has become acidic. Problem to hoga. Ma'am, if you make the pH of the body acidic, suddenly the nucleus will say, what the hell? I am not working. I am going on strike. You have made the pH so toxic, so acidic. I am not working. There is going to be something known as nuclear chromatin clumping. There is something referred to as nuclear chromatin clumping. What do I mean by that? Let me draw a cell. This was a cell, as all of you know. In this cell, what did we have? This was, normally I always draw the nucleus like this, blue color like this. But now it's not normal nucleus. I'm saying nuclear chromatin clumping. So if this is the nucleus, the chromatin will become clumped like this. This is going to be nuclear chromatin clumping. Earlier the nucleus was like this, all blue everywhere. Now the nucleus has made chota clumps, so that is nuclear chromatin clumping. Is that okay with everyone? Have you damaged the DNA, the nucleus? That is what you wanted to do. So in the second step, what have you done? You have done anaerobic glycolysis, and because of anaerobic glycolysis, there is going to be distortion of the nucleus. There is nuclear chromatin clumping. This I have made as your chota wala flashcard. Done? Okay. तो क्या क्या गया? Phospholipid gone, nucleus gone. What is left? Only the protein is left. That is the third thing. Let's kill protein also. So the third thing that is going to get affected over here is this. First, you tell me, what is this structure? Where is protein formed in a cell? इसे क्या बोलते हैं? I will draw the entire thing. Tell me the name of this structure that I have drawn. Which organelle is it? Is it endoplasmic reticulum? Is it smooth endoplasmic reticulum or rough? I think it is rough endoplasmic reticulum because I can see these greenish color ribosomes attached. And do I need rough endoplasmic reticulum for protein synthesis? I know that. We all know that RER makes proteins. But over here, this is not normal na. There is no oxygen hypoxia state chal raha hai. Ribosomes say tata bye bye. Ribosomes say we aren't going on strike. Oxygen ही नहीं है, हम काम नहीं करेंगे. Ribosomes are going to detach. Now tell me, ribosomes alag, endoplasmic reticulum alag. Now will protein synthesis occur? It will not occur. This is going to result in a decrease in protein synthesis. Now finally the third thing that you had to damage, protein, gaya. But body, see, just imagine someone is trying to damage your body. Your body will not keep quiet and sit, अच्छा नहीं बना रहे मत बनाओ. Nucleus भी तोड़ दो, protein भी जाने दो. Your body is sitting. No, your body will try to fight. So as a compensatory mechanism, your body says that I will increase the fat or the lipid content. So if protein synthesis is going down, the fat change ends up happening. So this is going to result in what in the cells? It is going to result in fatty change of the cells. This is going to result in fatty change of the cells. So now let me come back. How did you decrease the protein? Remember, in the rough endoplasmic reticulum, the ribosomes are going to detach. So if the ribosomes are going to detach, of course there is going to be a decrease in the protein synthesis. Are we all okay with this concept? I hope there is not a problem. Finally, you must have read this in Robbins and must have really broken your head over it कि reversible cell injury में चल क्या रहा है. But what have I taught you? 3 backbones of a cell. Phospholipid, nucleus, protein. You have broken phospholipid, nucleus and protein. So cell injury khatam. But this is reversible, which means till here, if you take the patient to the hospital, can all of this go back to normal? Is this all reversible? Yes, that is why I called it reversible cell injury and we have all studied it. If you take him to the hospital, he'll be fine. But if the injury continues, you don't take him to the hospital, now what is he going to go into? Irreversible cell injury. And that is the next short note that all of us have to know. The next short note has to be irreversible cell injury. So आज के लिए one short note पक्का वाला. You ready with reversible cell injury short note आएगा? Will you be able to summarize? Now let me tell you, go back and tell you the art of writing this question. Over here you will make sure, if I say you have got a short note on reversible cell injury, you will say first I will write an introduction. Most common cause of cell injury is hypoxia. Most common cause of hypoxia is ischemia. इतना लिख के then you write everything I have told you about reversible. पूरा flowchart बनाया. What do you write in the summary part? Summary needs only 3 bullet points, not even 5. What are the 3 bullet points? How do you kill the phospholipid, the protein and the nucleus? So you will write failure of sodium potassium ATPase pump results in myelin figure formation. Anaerobic glycolysis results in nuclear chromatin clumping. Ribosomal detachment results in decreasing protein synthesis. These 3 become your summary points over here. And now do you think if this is your crux and summary written, the body of the answer examiner might read very superficially because he knows कि उसको summary में इतना अच्छे से इसने summarize कर दिया तो detail तो पता ही होगा. That is when you can take out 3 lines out of it. That is how you will be writing every answer. Abhi I will tell you many more things. How to highlight words, what to highlight, how to make flowcharts, how to make diagrams. But this remains the same everywhere. Introduction, body and summary. Let's move forward. If reversible cell injury continues, the body enters into irreversible cell injury and that is the next short note that you have to get. You tell me, what do you understand by irreversible cell injury? Irreversible matlab once it has happened, now it is forever. You cannot get it back to normal. So you will ask me one point that let's say there is a patient of heart attack. Everyone has heard of chest pain, myocardial infarction, heart attack. Patient comes to you to the hospital. You will ask me, till what time in the heart attack, ma'am, do you know कि अच्छा अभी तक it is reversible cell injury and beyond these many minutes it is irreversible cell injury. So don't write it right now. I will teach you in heart attack in cardiac chapter. For the heart, it is roughly 30 minutes. First 30 minutes of heart attack, if you make the patient reach the hospital, reversible cell injury. After 30 minutes, if the heart attack continues, it is now irreversible cell injury. So you will ask me, how did you find out, ma'am, that for the heart the timing is 30 minutes, under 30 minutes reversible, after 30 minutes irreversible? Because there are two defining moments. I decided this timing because as a pathologist there are two defining moments for irreversible cell injury. If I see those two things happening, I'm like gone. I'm like, okay, this is irreversible. Ab kuch nahi ho sakta. Now nothing can happen. What are those two defining moments? It is going to be M and M. What is M and M? So what I'll do, I will draw one big cell for all of you so that we can all guess this together. This is a cell, and over here, of course, this is the membrane of the cell. So this is a cell membrane. Now tell me, you are talking about irreversible cell injury. Irreversible means the cell is gone, it's injured. What is going to happen? The membrane is going to get damaged. So the first M is going to be membrane damage. First defining moment. If I as a pathologist see कि cell का membrane पूरा damaged है, I'm like, okay, now nothing can be done. It is irreversible cell injury. Now it's like in Bollywood movies they say ना, अब कुछ नहीं हो सकता. Same way. Once I see the membrane is damaged, I'm like, okay, gone. This is irreversible. Now I can't do anything. So now tell me the pathophysiology. As soon as the cell membrane is damaged, which is the first thing which will run inside? I'll give you options: sodium, potassium, magnesium, calcium. The first thing to run inside is going to be calcium. Anyone who can tell me why? Like for example, if you're sitting in a lecture hall in your college, till the time the door is closed, all of you will have to stay inside, or all of you will have to keep inside the room. As soon as the door is open, everyone can run out or anyone can come in. So same way, as soon as the door will open, sodium can also come in, potassium can also come in, magnesium can also come in, calcium can also come in. But why am I focusing on calcium? That calcium is the first one to run inside the room. कोई मुझे बता सकता है? Because this is not pathology, this is physiology. Negative outside. See, the real reason being, somewhere you are right, I'll just add on to that. Calcium na normally 99.9% you and I, normal people, हमारा calcium is always outside. Why is that so? Why has God decided that 99.9% of the calcium should remain outside the cell? ऐसा क्या problem है? That calcium should not come inside the cell, because calcium, we all have that one student in the class whom the teacher says, okay, don't talk to this student because he will spoil all the other 100 students in the class. Calcium is that one student. You get him inside the cell, and this calcium will now go and activate all the enzymes. As soon as the calcium comes inside, it activates all the enzymes. In biochemistry, how many, don't worry, whenever I say biochemistry, students suddenly feel, oh shit, ma'am is going to ask us Krebs cycle and what all, yaad nahi hai. No, I'm asking you something very basic. Do you remember in biochemistry, every enzyme needed something called as cofactor? Sometimes they needed vitamin B6, sometimes they needed calcium. Calcium is a very important cofactor. You give calcium, all enzymes start working. So you tell me, normally sitting here in this class as a normal person, do you want that calcium should activate all your enzymes, or hum baithe baithe like that only we should die? Because as soon as my enzymes will get activated, my cells will start dying. Do you want that to happen? Of course not. So God said calcium is the naughty student of the class. Calcium comes inside, he starts activating all the other students. Calcium ko bahar rakho. 99.9% of our calcium is extracellular, outside the cells. Now imagine, calcium was very furious कि God has done injustice to me, मुझे बाहर रखा. Calcium is like, I have been kept outside. The day this door will open, I will be the first one to run inside. And that is what has happened in irreversible cell injury. As soon as there is membrane damage, calcium बिल्कुल ऐसे marathon लगा के भाग के it comes inside, and you know once it comes inside, it will activate all the enzymes. Let me check if you know what all enzymes it can activate. You know it. I know. I can actually guarantee that you know it. Maybe you're not having confidence, but I will make you speak it out. Tell me, if you want to do cell injury, do you remember the three things you wanted to break? Phospholipid, protein, and nucleus. Now you tell me, which is the enzyme for breaking phospholipid? What is the enzyme for breaking phospholipid? It is phospholipase. Calcium will activate phospholipase. What is the enzyme for breaking protein? Protein के लिए what enzyme is there? Protease. What is the enzyme for breaking nucleus? It is going to be Nuclease. How difficult is that to learn? Don't mug up. It's the same story everywhere. Wherever you have cell injury, you are going to break the same three things. You will break the phospholipid, the protein, and the nucleus. You will break phospholipase, protease, nuclease. And calcium is that naughty student that is going to now activate all of these. But now I want to ask you one more thing. Calcium ने काम तो कर दिया, it has done its work, but every naughty student also keeps quiet for 1 minute. It will need some rest. Where should calcium go and rest? Calcium goes and then deposits. It says, okay, now I have done my work, now I will chill. Now it deposits in which organelle? It deposits in the mitochondria. So we are going to make a mitochondria and the cristae over here. And calcium says, I am going and sitting inside mitochondria. So now mitochondria will be like, oh no, I am also damaged. Can I say the next M is going to be mitochondrial damage because of calcium? So now you know which are the two things that I see when I say, "Arey cell gaya." The cell is gone forever. It is irreversible cell injury. When I see two M's, one M is going to be this membrane damage and the other M is going to be this mitochondrial damage. If I see these two things getting damaged, I'm like gone. Now I can't do anything for this cell. And now do you know what is this known as? When calcium deposits in mitochondria. कितना simple लग रहा है ना, sound कितना simple कर रहा है. Calcium depositing in mitochondria. How easy? Do you think pathology can be that easy? Calcium in mitochondria? Not at all. They said, let's give it a big name and let's confuse them thoroughly. This is known as amorphous flocculent densities. This is known as amorphous flocculent densities. Now, if you tell someone, if you want to boast your knowledge ever in front of your friends, you can ask them, hey, do you know what is amorphous flocculent densities? And they'll feel that you've done some invention and बहुत बड़ा सा कोई नाम बोला, but उसका real meaning is so simple ना. It is nothing but calcium sitting inside mitochondria. So now let me ask you 3 questions or 4 questions and you all have to answer. I can see earlier only Dr. Om and Dr. Shreya were answering, but now I can see Dr. Aishi, Dr. Dravish, others are joining in. So that is my entire purpose. Get over that inhibition that we cannot answer because what if I answer incorrect? The entire purpose is that I want you to answer. Make mistakes, answer as much as you can, answer correct, incorrect, ulta pulta, kuch bhi answer karo par karo, because the rule is that you will, all this that you're answering, you will forget. But by chance in between, you end up writing something grossly wrong. Galti se kuch bahut hi, out of the box thing you write, that you will remember till your end of MBBS. You will never forget that. It was that one class on 12th of November where I wrote something so absurd that everyone was like, what the hell has he or she written? But you will never forget it. Now, then that question comes and you are the only one who's going to get it right then. So make as many mistakes as you can. God gives you a pool of mistakes. You have 2 options. You make those mistakes in this class, or you take that mistake pool and then you go and commit those mistakes in the exam. So the choice is yours. I would want exhaust your mistakes in this class so that whatever 100 mistakes pool was given to you by God, that is done. Uske baad you have no more mistakes to make. Uske baad you will go to the exam and you will only get correct answers. So coming all the way back, tell me the 4 questions. Amorphous flocculent densities is made up of which ion? Calcium, magnesium, potassium, sodium. So of course, it is made up of calcium. Question number 2, and I'm seeing answers. If I see something wrong, I will point you out, okay? Don't mind that. If I ever take your name for a wrong question, don't feel, oh shit, ma'am took my name and I was incorrect. That means I want you to remember it, and that's the only thing. Calcium, everyone knows. Question number 2, which organelle is amorphous flocculent density seen in? It is seen in mitochondria. Question number 3, which injury is amorphous flocculent density seen in? Reversible or irreversible? So it is seen in irreversible cell injury. How simple. This is question number 1, calcium. Question number 2, mitochondria. Question number 3, irreversible cell injury. The deal is question 4, so that you will listen to me a little carefully. If now I have to summarize abhi tak ka 2 main points. If I ask you amorphous flocculent densities are seen in which injury, you will say irreversible cell injury, ma'am, final answer. But if I go a little back and I ask you myelin figures are seen in which injury, so you will say, oh ma'am, when you were teaching me myelin figures, you were teaching me reversible cell injury. So are myelin figures only seen in reversible cell injury? Now that's the catch, because I want to tell you that myelin figures are seen in both. Please note, myelin figures are going to start, because now I have taught you everything, so I will teach you this thing also. Myelin figures start in which injury? They start in reversible cell injury, and they increase in number in which cell injury? They increase in number in irreversible cell injury. So that means now I want to tell you that when you are reading cell injury, myelin figures, let's take a random number. In reversible cell injury, there were 5 myelin figures. Start ho gaya banna. 5 myelin figures. As you went to irreversible cell injury, they became 50 or 500 myelin figures. So now tell me, myelin figures are seen in reversible cell injury, irreversible cell injury, or both? Myelin figures are seen in both. But amorphous flocculent densities are only and only seen in irreversible cell injury. Yaad ho gaya? Myelin figures both, but amorphous flocculent density only in irreversible. So now coming back, what were the two defining moments for irreversible cell injury? M and M. M means membrane damage, M means mitochondrial damage. But I have one small little doubt which you should have asked me. I am asking you. Ma'am, you activated all the enzymes and you said cell gaya, khatam, cell is injured. Phospholipid you broke, okay. Protein you broke, okay. Nucleus you ended up breaking like that in a second. Do you know what the nucleus has? Nucleus has the DNA. 23 chromosomes your mother has given you. 23 chromosomes your father has given you. Then 23 plus 23 you became 46 chromosomes. So much of effort your mother and father did in giving you 23 chromosomes. Pura aapka nucleus banaya, DNA banaya, what all your parents did for you, and you think this one enzyme can come like this and say okay, tata, bye bye. No, it can't happen. Nucleus cannot come and say win 1 second nucleus is gone, not at all. So please remember that when I say that nuclease enzyme is acting, nuclease will not break the cell like this, khatam, not at all. There are going to be nuclear changes. 1, 2, 3, gone. It is going to be a 3-step thing. It is going to be 1, 2, 3, and then the nucleus will get damaged. So they ask you, what are the nuclear changes? Rather than writing it theoretically, I have made a diagram over here. So same diagram you will make when you go in the exam also. So that examiner doesn't have to read all your theory part. Examiner can only see the diagram and know that this person knows. So what are the 3 changes? The 3 changes are PKK. PKK hota hai, then the nucleus goes. So first I have made a normal nucleus. You can see the normal nucleus over here. Then which enzyme acts on it? Nuclease enzyme acts on it. The first change that occurs is PKK mein pycnosis. Please you tell me the description of pycnosis. Compare it with a normal nucleus. What has happened to the size of the nucleus? Has it become bigger? Is it normal? Has it become smaller? Because I think in pycnosis there is going to be nuclear shrinkage. Do you agree with me? I think it's become smaller. It's become smaller. There is going to be nuclear shrinkage. Excellent. You're right. It has become condensed. That's the more technical term for it. Very, very good. So Dr. Aishi says it is condensed. It has become point size. Chota ho chuka hai. Very good. One more point you will tell me. Look at the color, light bluish, whitish color of normal nucleus, whereas in pycnosis, has it also become darker? Obviously, na, because just imagine all this material had to be fit in a chota sa space. It had to be fit in a small space. So can I say it is going to become very dark blue? The color is going to become dark blue. What is dark blue known as in pathology terms? Nucleus becoming dark blue is known as hyperchromasia. Whenever they say nucleus is hyperchromatic or nucleus is hyperchromasia, hyper means more, chroma means color. Nucleus का क्या color होता है? Nucleus is blue. So more color, more blue. Whenever the nucleus is dark blue, I will use the color. Hyper means more, chroma means color. So dark blue के लिए hyperchromasia. Do we all agree with this term? First step is pycnosis. After that, what is nuclease enzyme will keep on acting? What is the next thing? I can see now there is a bomb blast. Nucleus chota parts में it has broken. So when I say the word karyo, karyo means nuclear and rexis means fragmentation. So what I can see over here is going to be nuclear fragmentation. Nuclear fragmentation means that the nucleus has split into chota parts, and that is karyorexis. Finally, nuclease enzyme works more. And now I cannot see the nucleus only. Gayab, nucleus has gone. It is now known as karyo. Karyo means nuclear and lysis means gaya, lysis is gone. So lysis means it has dissolved. Nuclear dissolution. Repeating once again, first is pycnosis, and Dr. Aishi, as you've asked that ma'am, why is there hyperchromasia? Very good question. You tell me that if, for example, I give you 10 pencils and I give you this bigger pencil box, your pencils will be kept everywhere. But then when I give you chota sa jagah, I say no, fit the 10 pencils in this much of pencil box. How will you fit the 10 pencils? You will put them very close to each other. You will put them one on top of the other. Kisi tarah aise ठूस के you are going to fit it in that pencil box, right? Same you have done. Earlier, you had so much of space to fit in all the nuclear material. Now you have chota sa space to fit in all the nuclear material. Do you agree that you will keep all the nuclear material one on top of each other? You're going to stuff it inside, and because of that stuffing, it looks as if it is very, very blue. So hyperchromasia is only because there is an element of pycnosis, or there is an element of the cell size which is becoming smaller. The nucleus is becoming smaller, and that is why there is hyperchromasia. Okay, because you're trying to fit in everything in that much of space. So jaldi se, before I move forward, all of you are going to tell me what is nuclear changes PKK. P stands for pycnosis, K stands for karyorexis, and K stands for karyolysis. Okay with everyone? Settled up till now? Finally, your irreversible cell injury is done, and I will take 10 seconds to repeat. Quickly listen to 4 questions. First question, what are the defining moments of irreversible cell injury? You will say MNM. Membrane damage, mitochondrial damage. Question number 2, what are the mitochondrial damage over here? What gets deposited? Calcium gets deposited. Question number 3, what is that known as? Amorphous flocculent densities. Question number 4, the nucleus that is breaking in how many steps? PKK, pycnosis, karyorexis, and karyolysis. Finally, irreversible cell injury bhi khatam ho gaya. And now we come to the next part, and that is going to be cell death. Everyone's okay with this? May I move forward? 1 hour is done. We are going pretty well with whatever we had planned. Our plan today is, of course, doing reversible injury, irreversible injury, and whatever cell death we can cover. So we are going to start with cell deaths. How much of it will I be able to cover today? I don't know, because cell death thoda sa lamba chalta hai. For giving you a brief, cell death includes what all? It includes necrosis. Second, I think these two, तो even as a second year student you've started off, you know. Second is apoptosis. दोनों cell deaths को combine करेंगे, we will get a third cell death, which is necroptosis. So necrosis and apoptosis is necroptosis. The fourth one, which is come up nowadays, is going to be pyroptosis, and the fifth one is going to be anoikis. This is what you have to study now. So as you know, it is a lengthy topic, तो अब थोड़ा time लगेगा. अभी तक overall, I always work on feedback, and both good feedback, bad feedback, criticism, everything is welcome. You need to tell me कुछ add करना है? Is the pace of the class okay? Is the understanding okay? Is the content okay? Is the handwriting okay? Is the concept part okay and mnemonic part okay? Everything should be okay. You think anything needs to be added? Ma'am, थोड़ा ज़्यादा explain कर दो, थोड़ा कम explain कर दो. Any kind of feedback, because it's our first class. So you need to get used to me, and I need to get used to you guys, because we are going to be in this journey till July and beyond. So that means that now we have to come to that comfort level where we can give each other feedback. If I think you guys are not studying in any class, I also have the right to scold you and tell you padna hai, you have to study. If at any point you feel that no ma'am, nahi samajh aa raha, please repeat it 2-3 times over, don't hesitate. I will repeat it as many times possible. Okay, yeah, Dr. Shreya, we are working on that, and because this month's classes were already planned, so tabhi is month ka 4 o'clock hai, but December onwards I have already put that to the team that the classes should be 5 p.m. beyond, because I understand you guys have college. So I think 5:30 रख लेंगे, because everyone needs that half an hour breather to settle and all. So we can keep it between 5 and 5:30, and I think that should be good for everyone, because 5:30 we start, so by 7:30, 8 max we are done. Then you're not even stuck in any dinner time or anything. So I will make sure that this happen. I will try my level best. It can happen for day after tomorrow only. Day after tomorrow we have microbiology. I will try my level best कि उसका भी change हो जाए to 5 o'clock. But December is my promise that we will have classes after 5 p.m. Okay, ठीक है. Rest everything is perfect. Great guys. So now we get going. Now the level up, थोड़ा सा speed up, not too much speed, but just that अब समझ आने लग गया ना, so now you're used to how I'm teaching, so now you will anyway start listening to me faster. Let's start with cell death, and that is going to be necrosis. सबसे पहले हर चीज का डेफिनेशन, यू से अरे सो सिंपल डेफिनेशन मैम, इट इज सेल डेथ. नेक्रोसिस इज सेल डेथ. आई विश इतना सिंपल होता. एक वर्ड ऐड करना है. नेक्रोसिस इज pathological cell death. Anyone who can tell me the meaning cell death, you understand cell has died. What is pathological? If something is going to be okay, irreversible cell injury कैसे okay, sorry, I didn't understand your अच्छा, you Dr. Aishi, did you say that in terms of short note कैसे लिखना है? बिल्कुल as it is, जैसा हमने पढ़ा. For irreversible cell injury, any cell injury comes, your introduction is the same. Cell injury is of two types: reversible cell injury, irreversible cell injury. Or what you can also write is, everywhere this flowchart will fit. चाहे reversible cell injury का short note आए तो भी this flowchart will fit. Irreversible cell injury का short note आए then also this flowchart will fit. Cell death का short note आएगा then also this flowchart will fit. So this has to be the first flowchart for every short note. After that you will write पूरा हमने जो irreversible cell injury पढ़ा, along with that जो nuclear changes पढ़े, all of that you will write. And इसमें से now you see, what do you think should be the 3 bullet points summary में जो डालना है. I think the 3 questions that I asked you ना right now, the first should be summary में 2 defining moments are M and M. The second should be it causes amorphous flocculent density formation. Third bullet point should be nuclear changes include P, K, K. बस यही था ना 3. And in fact, one day before the exam, you will not have time also to actually go through this entire short note. What you're going to read also are these 3 points. Is that okay? So after that, Dr. Aishi, after every topic, when I ask you those 3 questions, na, वो 3 questions I asked because those are your 3 summary points. Okay, let's get going. Cell death. Cell death में क्या पढ़ना है? We have to study first necrosis. Necrosis का definition से start करते हैं. It is pathological cell death. Who will tell me the meaning of pathological? तो 2 terms होते हैं. One is physiological, one is pathological. Basically 2 subjects of your MBBS, physiology and pathology. Physiology मतलब normal of the body. Normal is physiology. Pathology is diseases. So tell me, necrosis, can it be seen normally? Like you and me sitting over here, are we having necrosis in the body? No. Necrosis is never normal. When they say necrosis is a cell death, necrosis is always going to be pathological. हमेशा disease होगा. Exactly. Still the story is not over. It is always associated with inflammation. It is always associated with inflammation, and I will teach you a little bit about this as we move forward. क्या है inflammation? What do you mean by that? For the time being, for 5 minutes, you will have to learn this definition. It is pathological cell death associated with inflammation. Then I will show you photos. Before I show you photos, how is the photo supposed to look like? On microscopic examination, how does necrosis look like? So number 1, you tell me, try to analyze. It is a cell death. The cell has died. Do you think that after death, the cell is going to have a proper shape, a proper size, a proper structure? Will you be able to see the structure like membrane, nucleus? ऐसा कुछ दिखेगा? कुछ नहीं दिखेगा मैम. Cell death मतलब गया. Morphology is gone. The looks are gone. If the looks are gone, morphology is gone. I call it amorphous. Now you've understood what is the meaning of amorphous? Amorphous means there is no morphology. No morphology means amorphous. Okay, that is how it's. When I look at the slide under the microscope now, when I'll show you photos, you will not see any round size and shape and structure. Kuch nahi. It will be amorphous. It will be pink in color. So now let me ask you, how many of you after entering second prof have you bought those 2 famous pencils that you're supposed to, the HNE pencils? Have you purchased them? You will use them thoroughly. You will not understand much in second year, but you will use those 2 pencils for all your practical files. What is HNE before I start? Because now you need to tell me there is H, which stands for hematoxylin, and then there is an E, which stands for eosin. One day when we go to the practical classes, I will teach you how properly this is done. अभी के लिए basic क्या है? Hematoxylin is the one that is going to be blue in color. and eosin is the one that is going to be pink in color. So those two, the bluish and pinkish pencils that you've purchased, those are the H and E pencils. They are the hematoxylin and eosin pencils. So you tell me, if I'm saying necrosis देखने में pink होता है, तो what should I say? Is it blue होता है तो we call it basophilic, pink होता है तो we call it eosinophilic. So please remember, when something is blue, I am going to call it what in pathology? I call it basophilic. And when something is pink, I am going to call it eosinophilic. See, philic means what? Philic means loving. Eosin loving, that is why pink. Basophilic means blue loving, that is why blue. So you tell me, necrosis is what? Necrosis is pink. Pink को क्या बोले? Can I say necrosis is eosinophilic? Is that making sense to everyone? Can I write that necrosis is going to be eosinophilic material, pink color material? So what do I see? Before I show you the slide, पहले तो समझ लो ना. After that, so you will see a photo and you will anyway understand. It is a pink color material, pink color, eosinophilic, and will it have any morphology? It will not have any morphology. और क्या दिखेगा? Third thing, the definition said it is associated with inflammation. So will you be seeing some inflammatory cells under the microscope? I know Abhi, you have not studied the inflammation chapter, but you know what is inflammation? Basic. Have you heard of cells like neutrophils, lymphocytes, blood वाले cells का नाम सुना है ना? Neutrophils, lymphocytes. Those are inflammatory cells. You see those inflammatory cells. So keep in mind that, ma'am, when you will show me the photo of necrosis, you will show me some pink material which will not have any size, shape, no morphology, and you will show me some inflammatory cells. This is basic. इतना बस दिमाग में रखो. Now let me start with the type of necrosis. The first type of necrosis is the most common type of necrosis, and that is coagulative necrosis. It is the most common type of necrosis that you have. So some universities give necrosis pura short note. Some universities give one type of necrosis as a short note. So you might get a short note only on coagulative necrosis only. But the story remains the same. कोई भी necrosis पूछा जाएगा, your introduction will be, give them a definition, then start with the necrosis. थोड़ा सा उनको एक introduction दो कि अच्छा necrosis is pathological cell death with inflammation. It looks like pink amorphous material with inflammation. And now they have asked me coagulative necrosis. So let me tell them the 4-5 questions of coagulative necrosis. Question number 1 or bullet number 1, it is going to be the most common type of necrosis. Next question or bullet point is mechanism of action. होता क्यों है? Anyone before I start? Coagulative, what do you understand? Is something becoming solid or is something becoming like pus and liquid? Basic word. Like for example, have you ever boiled eggs? Eggs are originally liquid, but and eggs are very rich in protein, you know that na? So when you boil eggs, you are basically heating the protein. What happens when you boil egg? From liquid it becomes solid. Egg solidifies. Boiling of egg में क्या होता है? Proteins में change आता है मैम, and the egg solidifies. Basically, in scientific terms, boiling of egg will be known as that the egg is getting coagulated. The proteins are getting coagulated. इसे बोलते हैं basically egg boiling. What common man calls as egg boiling, the medicos call it as coagulum in the egg is forming. Egg is getting coagulated. So coagulative necrosis में same egg वाला concept हो रहा है. Egg क्यों solid हो रहा है? Why is the boiled egg becoming solid? Because there is denaturation of proteins. In coagulative necrosis also, very good, like Dr. Aishi says, there is going to be denaturation of the proteins. Excellent, guys. This if you've understood. So now I will be able to tell you some diseases where all this happens. What are the sites where this happens? So the sites include all the solid organs. The sites include all the solid organs. Name some solid organs like you all know. One of course is the heart. The second one is going to be the kidney. One of course is going to be the liver. And in the exam also you should try and make these diagrams. So when you go in the exam and you write your answer, of course you will write heart, kidney and liver. But side mein if you make these chota diagrams in the same line, your examiner tends to find your answer more attractive. Also, when you're writing a short note, please write the way I am writing. Please write bullet, 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 bullet. This is one bullet point. Don't write a paragraph. जैसे Robbins में लिखा है. Just imagine, do you like reading Robbins from exam point of view? As knowledge, it's a beautiful book, but exam point of view डर लगता है ना, because it is written like a story, continuous paragraphs. Just imagine examiner reading your answer like that. He will never give you marks. Even if you've written the best answer, he will not give you marks, because it is very tough to read paragraphs written like this. On the other hand, if you have written bullet points, examiner automatically आपके content को he starts giving more weightage. He starts reading it. Actually, it will generate interest. You will read this with more interest than you will read Robbins, only because that is written. Even though Robbins is much better than what I am teaching, I admit it. Robbins is the best book, but उसका सिर्फ लिखने का pattern is why students don't like it. This is how you have to write your exam. Now, where do you see it? Heart, kidney, liver, solid organs. So let's assume in the heart, let's take the example of MI. Do we all know what is MI? Myocardial infarction, heart attack. Now what will happen? In heart attack, of course the heart is going to die. What else? Heart attack mein heart dies. So heart is a solid organ. What kind of death occurs in the heart? Coagulative necrosis. In the kidney, if there is say any poisoning or any hypoxia, kidney में injury हो रहा है, which necrosis? Coagulative. Liver में injury हो रहा है, which necrosis? Coagulative. So now the next question is, how does it look like? Let's take the example of kidney. Let's assume, because in Robbins this is the photo given. I've taken all photos. I've tried my best that I take the same photo as Robbins so that you can later on read and correlate. So over here they have given you a slice of kidney. This is going to be a slice of kidney, and in the kidney, as all of you see, this is the normal area. So normal kidney कैसा होता है? Normal kidney is basically going to be brownish in color. The normal kidney is going to be brownish, reddish, brownish. But do you notice that in the kidney there is this solid yellowish area, and what is the shape? It is a wedge shaped area. They have written it as wedge shaped infarct. इसका क्या मतलब है? Wedge shaped, has everyone understood? Wedge means it's looking something like a triangle. But what is the meaning? So somewhere over here there must have been a blood vessel. Every organ has a blood vessel. Renal vein होगा, renal artery होगा, renal है तो renal blood vessels होगा. But in that blood vessel, let's assume there is a clot. I'm just giving you one example. Let's assume there is a blood clot. Do you think the yes or no? Do you think kidney will get blood supply? अगर blood clot आके फंस गया, one blood clot is stuck over there, do you think this kidney will get blood supply? It will not. If there is a blood clot, there is going to be altered blood supply. And because of this altered blood supply, what is going to happen? There is going to be death. Cell death, and that cell death is going to look like this area, wedge shaped area. So now I want to ask you that grossly the next bullet point that in the exam, don't think ma'am exam में कैसे photo बनाए, इतना सा photo बनाने में कोई problem नहीं होती. You can always make one slice of kidney and you can always highlight this के okay, this is the wedge shaped area that is going to be there. So examiner will automatically know that okay, this boy or girl has read Robbins. इसे पता है there is a wedge shaped death area that is there. Number one, I want to ask you something. क्या वो solid लग रहा है या ऐसे पस बन चुका है या liquid okay, it has flown away? I don't think it has flown away. I think it is still solid. So can I say kidney was originally also solid? Solid organ है. And after coagulative necrosis also it is solid. So can I say that tissue architecture did not change? Tissue architecture is going to be preserved. Tissue architecture is going to be preserved. Why? Because earlier also kidney was a solid organ. Now also change हुआ है, death हुआ है, but it is still solid. Same, if heart attack happens, solid will remain solid. If liver damage happens, solid will remain solid. No pus will form over here. Because now what you will see is going to be the microscopic examination. By the way, for the entire pathology, ME refers to microscopic examination. So let us see how the microscopic examination looks like. Finally, we have reached the pink and blue of pathology, which I wanted to teach you. And now, before I go on to anything, first I will ask you your interpretation. Don't worry, you might feel that ma'am tells us we understand, but then when we see the slide, we don't understand anything. So I will ask you, and then maybe you will be able to understand better. If I tell you, फिर तो कोई फायदा नहीं है. Let's zoom in first, because right now we are into zooming in phase. We are too early in stage now. We are babies right now. So look at this cell. Any cell that I am encircling, just keep looking at the cells that I am putting a circle around. And tell me, in every cell, do you see a blue color dot? Yes or no? In every cell that I have encircled, do you see 1 to 2 blue color dots? What are those blue color dots? Those are the nuclei. Blue color क्या होता है? Nucleus होता है. Tell me, a cell with a nucleus, is it going to be a living cell or a dead cell? Obviously, the cell with the nucleus is a live cell. It is very much alive. Okay, so I realize till this much of the photo, if you now look carefully, this part of the photo without zooming in, अब देखो हर में वो blue color का dot है. This means this part of the photo is totally alive. It is totally normal. If I consider kidney के यहाँ से normal area में से अगर फोटो लिया था तो मैम नॉर्मल एरिया इज गोइंग टू लुक लाइक दिस, टोटली लिविंग, टोटली अलाइव. Whereas this dead area, if I look at this dead area, now you tell me, because I will zoom in again for you, whatever I will encircle, tell me, do you see that blue color dot or not? In this structure, this pinkish structure, do you see any blue color dot inside? Because I can't see. In this pinkish structure, do you see any blue color dot? In this pinkish structure, do you see any blue color dot? और भी देखते जाओ आसपास. In this pinkish structure, no ma'am, all that I'm seeing are pink color things. All that I'm seeing are cells. For example, ऐसा outline दिख रहा है and inside it is all pink. That's all that I'm seeing. So can I say outline तो दिख रहा है? Definitely. I am saying outline is preserved. But do you see anything inside? Do you see any details? No, the details are lost. I don't see any nucleus. Sirf outline. Like in Bollywood movies, because they don't use too many VFX, they don't use effects. How do they show you ghosts in Bollywood movies? They make one person wear a white color bed sheet और वो गोस्ट बन जाता है. मोर ऑफ कॉमेडी देन हॉरर दैट हैपन्स. तो एग्जैक्टली जो बॉलीवुड का गोस्ट होता है ना, उसको व्हाइट कलर का बेडशीट क्या होता है कि मैम आउटसाइड तो ऐसा व्हाइट कलर का बेडशीट दिख रहा है कि ओ इट्स अ गोस्ट, आउटलाइन तो दिख रहा है, बट इनसाइड कैन यू सी एनी फेस ऑफ द पर्सन, आईज ऑफ द पर्सन, इनसाइड डिटेल्स दिखता है? नहीं दिखता. एग्जैक्टली हाउ दीज सेल्स लुक लाइक, दैट इज वाई दे आर नोन एज गोस्ट सेल्स. ये बॉलीवुड के गोस्ट की तरह है, आउटलाइन दिखता है, व्हाइट कलर वाला बेडशीट, एंड देर इज नो डिटेल दैट इज सीन. दैट इज व्हाट यू कॉल एज गोस्ट सेल. सो टेल मी, आर यू सीइंग वन गोस्ट सेल और आर यू सीइंग many ghost cells? I can see so many pink color ghosts. All of these are pink color ghosts. So मतलब मैम ये तो scary हो चुका है. This has become very scary. That is what? Why is it very scary? बिकॉज गोस्ट्स मैम इतने सारे गोस्ट, ये तो मुझे ग्रेवयार्ड लग रहा है. दिस इज लुकिंग लाइक अ ग्रेवयार्ड. तो ग्रेवयार्ड में क्या पड़े होते हैं? स्टोन्स पड़े होते हैं. हर कॉफिन के ऊपर एक स्टोन, लाइक हॉलीवुड मूवीज में ज़्यादा दिखाते हैं. हर डेड बॉडी के ऊपर एक स्टोन होता है, स्टोन पे उसका नाम लिखा होता है, एज लिखा होता है, 1954 to 2024, लाइक दैट इट इज रिटन. सो दैट इज वाई सो मेनी गोस्ट्स आर प्रेजेंट. सो दिस इज नोन एज द tombstone appearance. What is this called? Tombstone appearance. Meanwhile, Dr. Om has asked us why periphery has purple stain. कौन सा वाला periphery? Sorry, this purple तो I have made, by the way. This is not real. This is my marking. Is this what you were asking me? And ये जो purple color use करे, ये तो मैंने करा ना use for asking you questions. Which purple stain otherwise are you asking me कि periphery में purple है? वो तो मैंने बनाया. That I have made with my pen only. Okay, not that. So tell me, कौन सा वाला? Tell me which one are you talking about? Which periphery has purple? Okay, I think I kind of, tell me if I've got it right. Dr. Om, are you trying to ask me कि ये तो मैम पिंक कलर का लग रहा है. Are you trying to ask me what is this? ये जो डॉट दिखाई दे रहा है, is this what you are trying to ask me? Because I'm exactly coming to that. Give me just a minute on that. So please note, अभी तक हमें क्या समझ में आया कि this is going to be ghost cells and so many ghosts are what? Tombstone appearance. So now I want to take you back to the definition. जो theory पढ़ा था, and Dr. Om, this will answer your question. theory में जो पढ़ा था उसे apply करो ना. Necrosis कैसा दिखता है? Pink. Is necrosis looking pink? Are these all pink? Number 1 point agree कर लिया कि वो pink होता है. Number 2, it was written it is amorphous. मतलब कोई आंख, नाक, शक्ल, nothing, no details will be seen, no morphology. Can I say details are lost? ये भी समझ आ गया मैम. सो पिंक भी समझ आ गया, एमॉर्फस भी समझ आ गया. सो नाउ टेल मी डॉक्टर ओम, जो बचा हुआ डॉट होगा वो क्या होगा? व्हाट सेल्स आर दोज? नेक्रोसिस इज एसोसिएटेड विद इन्फ्लेमेशन एंड दैट इज एग्जैक्टली व्हाट आई सेड दैट आई विल शो यू. ये गोस्ट के आसपास जो डॉट दिखाई दे रहा है, व्हाट आर दीज डॉट सेल्स नोन एज? दीज आर ऑल द inflammatory cells. Now you've understood this is going to be inflammation because this is what we had studied. अब सब कुछ जो पढ़ा था वो clear हो चुका है. So coming back, in necrosis, in coagulative necrosis, what do you see? I see ghost cells and I see tombstone appearance. Now I told you now that we will make one flashcard for coagulative necrosis, so that if you get a short note, उसी में आगे details लिखते जाना, but these are your bullet points that you have to cover. So listen to me in 15 seconds. Coagulative necrosis is the most common type of necrosis that we know. The mechanism of action is denaturation of proteins. What are the sites? It involves solid organ like the heart, the kidney and the liver. Out of this, if they ever ask you which is the most common organ affected, because heart attack overall सबसे common होता है, so the most common organ affected is heart. If they ask you how is the tissue architecture is preserved. If they ask you death का shape कैसा होता है, it is a wedge shaped area. Microscopically कौन से cells? Ghost cells. What appearance do they give? Tombstone appearance. Everyone's clear with the most common necrosis, coagulative. Can I move on to the second one? And that is going to be liquefactive. The name is only telling me, is the organ going to remain solid or is it now going to become pus and liquid? Common sense. Even if you're sleeping, you will answer this. Liquefactive necrosis में liquid बन जाता है. They have given another name to it known as coagulative necrosis. They have given another name to it, that is coagulative necrosis. That's also, they tried to act smart, but it's okay. Now liquid word is coming in that also. Coagulative. So please remember, liquefactive necrosis is going to be coagulative necrosis. It means the same. In this, the tissue architecture will not be preserved because यहाँ तो solid से liquid बन जाएगा. Tissue architecture is not preserved. The reason being that there is a liquid formation occurring. Let me give you example. This is seen in 3 places. Number 1, so I think all of you have experienced. Have you ever had an abscess in life? Abscess in Hindi it is known as foda, pus wala foda that they call in Hindi. Abscess हुआ है. What does abscess have? Abscess has pus inside it. What is pus? Pus is nothing but a liquid. Have you ever wondered pus कैसे बना? Pus is nothing but liquefactive necrosis. Pus is a liquefactive necrosis. Anything becoming liquidy in an abscess, liquefactive necrosis. Second 2 organs that I have is brain and pancreas. Brain and pancreas also have liquefactive necrosis. I don't think I need to tell you, ये तो basic anatomy सबको identify हो गया कि ये कौन सा organ है? Brain, common sense. So I can see the sulci and the gyri. This is pakka gray matter, white matter. This is pakka brain. But in this brain, over here, do you see there is one area which is looking कि जैसे उसमें pus हो गया हो? There is a lot of liquefaction that has happened over here in the brain. There is only one photo of liquefactive necrosis that they have. They always give you the same photo. So liquefactive necrosis in the brain is what you are going to call as coagulative necrosis. Is that okay with everyone? Apart so कैसे होगा? Let's assume you have a patient of stroke. Stroke brain में damage हुआ तो brain में क्या हो गया? Liquefactive necrosis. Let's assume you have a patient of acute pancreatitis. तो acute pancreatitis में what is the death in the pancreas? Liquefactive necrosis. So please note, now I want to complete. All solid organs show you which necrosis? Heart, kidney, liver, all solid organs show you coagulative necrosis. But brain and pancreas are also solid organs only. Normally solid ही होता है ना. But which 2 solid organs show you liquefactive necrosis? It is the brain and the pancreas. And you will ask me why, ma'am? When all solid organs like heart, kidney, liver show coagulative necrosis, तो brain and pancreas में ऐसा क्या है? That brain and pancreas show you liquefactive necrosis. Now we will do the reason. This is because high hydrolytic enzymes are present in the brain. There is a high level of hydrolytic enzymes that are present in brain and pancreas. I'll give you one example. Because I'm not going into too much detail because अभी हमने पढ़ा नहीं ना. We've not studied pancreas, we've not studied brain. But basic to anatomy, physio, you know that does pancreas have a lot of enzymes like amylase, lipase? ऐसा पढ़ा था physiology में that pancreas has amylase and lipase. Similarly, brain also has a lot of hydrolytic enzymes. It is because of these hydrolytic enzymes that the solid organ is converted to liquid. The solid organ is going to be converted to liquid. Understood? So now I will give you a although liquefactive necrosis अलग से short note नहीं आता because there's not much information to write. Either you will get necrosis as a short note, and that you will have to write about liquefactive. So please listen to the 3 bullet points. Liquefactive necrosis is also known as coagulative necrosis. Liquid word tells me that okay, there will be a solid organ, but it will be converted into liquid, so tissue architecture is not preserved. It is seen in brain, pancreas, very important. And why these 2 organs? Because they are very rich in hydrolytic enzymes. Liquefactive necrosis ho gaya. Can I move on to the third one? Living in India. If you don't know about this necrosis, you are then not living in India, or you are mentally not there, you are absent, you are not aware of what is happening in your surroundings, and that is caseous necrosis. Pathology theory में तो चलो आएगा ही आएगा, but in your practical exams there is no student who is not asked about caseous necrosis is pass fail question. केशियस नेक्रोसिस नहीं आंसर करा एग्जामिनर के सामने एज एन इंडियन ग्रेजुएट, you are going to flunk that practical exam. So in case you had fallen a little asleep till now, please jog jao, because this is going to decide your destiny. This is the worst, just I would never want that, but let's assume we all have bad days. Let's assume that day was the worst day of your life. Your luck had gone for a toss. बहुत बुरा luck चल रहा था मैम, हर वाइवा का question मेरा गलत हो रहा था. Whatever I left one day before, examiner was asking that only again and again. तो मुझे कुछ नहीं आता था. So then the situation came down to pass fail. I would never want that, but let's be prepared for the worst. Then the examiner said, ye answer bata do, I will pass you. And which is that question going to be? It is this: caseous necrosis. What do you mean by the word caseous? Caseous means cheese like. This is the first thing. Ye word caseous sunte hi start shouting, oh, it looks like cheese like that white color cheese. Caseous necrosis matlab cheese. And hamari country mein kyun important? Because this is seen in TB. So TB, tuberculosis, every word. Even if something has come as a headline in the newspaper, you should be knowing it, because examiner will get very angry if you don't give answers to TB living in India. So TB के बारे में कुछ भी छोड़ के नहीं जाना. I will teach you TB for 3 hours in microbiology, but then I will teach you everything about it. And Ankit sir will teach you the pharma treatment. So then after that TB will be done for you in second year. फिर medicine में आगे जाके नहीं पढ़ना. TB will be done in second year only. So coming back, caseous necrosis, you get a short note on this alag se. Caseous necrosis is going to be cheese like. But now I want to ask you, ये कौन सा organ है in front of you? Can anyone identify? जल्दी से, because over here I want you to be very sure that you guys are awake. I can't take the risk of anyone dozing off, sleeping off, feeling lazy. यहाँ पर तो it is not about you pass fail, it is about me as an educator passing or failing. अगर caseous necrosis नहीं पढ़ाया मैंने ठीक से, then I have failed. Okay, very good. All of you called it lungs. Why did you call it lung? Because it looks like that. And this is how we draw the lungs. How simple. What a question. This is how we draw the lungs. ऐसा नहीं करना examiner के सामने. Because what if the photo has been inverted and flipped 90 degree? Will you say कि अब ये ऐसा दिख रहा है तो ये लंग नहीं है? ऐसा नहीं होता. Please, I hope if you were making कि अच्छा ऐसा ही तो बनाते हैं ना मैम लंग. This is how we draw the lung. तो इसलिए हमने इसको लंग बनाया. No, if you zoom in, you can see air spaces. You can see the alveoli. Please, it looks like a sponge. ये खाली खाली जगहें दिख रही हैं. These खाली खाली spaces are what you call as air spaces, and that is why you called it lungs. So जब भी in the practical exam you will be given this specimen. The specimen will be put in that jar, glass jar. Don't say ऐसा दिख रहा है, because all of us we've done that. मैम ऐसा shape का दिख रहा है ना, that is why it is lungs. And examiner also smiles at us. So please remember, we made it lung because over here what I'm seeing are going to be the air spaces. Now inside the lung I can see this cheese-like material. So this is probably a case of pulmonary because of lung, and cheese material caseous necrosis. So this is probably a case of TB. तो अब पढ़ते हैं what is caseous necrosis. Caseous necrosis is a combination. It is going to be a combination of 2 necroses. अभी तक कौन कौन सा necrosis पढ़ा? Coagulative necrosis and liquefactive necrosis. And now if I'm saying it is a combination of these 2 necroses, you should have one doubt in your mind. In coagulative, did I say any word like cheese? I didn't. In liquefactive, did I say anything like cheese? I didn't. Then why am I combining the two and I'm saying, oh, now it looks like cheese? Is that making sense? No. Ma'am, जब यहाँ भी cheese नहीं था, यहाँ भी cheese नहीं था, तो how can you combine the two and say, oh, now how it's looking like white color cheese? What is happening? Please remember, caseous necrosis is seen in number 1 TB, So in our country, you have to know tuberculosis, but other than tuberculosis, it is seen in two more things. It is seen in fungal infections, many fungal infections, but they tend to ask you two fungal infections in the exam. One is going to be histoplasma fungal infection and the other one is going to be coccidioidomycosis. Histoplasma fungal infection and coccidioidomycosis fungal infection. Don't worry, I will teach you fungal infection in micro for good 4-5 hours. So don't worry about that. Apart from that, it is also or can be seen in syphilis. So where all can you see caseous necrosis, cheese-like necrosis, TB, fungal and syphilis? ऐसा क्यों? Now my question is, जब coagulative में चीज नहीं था, liquefactive में चीज नहीं था, तो what is it that in these when the two combine, ऐसा क्या है in bacteria and fungus में? All of them, the examples that I have given you, they have a very high lipid content in their cell wall. They have a very high lipid content in the cell wall, and this is what is going to result in the cheese. So just imagine TB, हम TB का example पढ़ते हैं ना, TB का cell wall, when you look at the cell wall, TB cell wall has a lot of lipid content. It has a lot of fat. That fat will start looking like cheese. Now you understand why heart attack में, heart attack was also coagulative necrosis. Heart attack के coagulative necrosis में तो there was no cheese. Brain के stroke में, liquefactive necrosis में there was no cheese. What is it about TB, fungus and syphilis that cheese starts forming? Because all these have a very, very high fat content. That fat will start looking like white color. So how I've learned it is fat से cheese बनता है, or cheese has a lot of fat in simple ways. That's how we learn it. But the concept is that because they have a lot of lipid content, that is why this white cheesy appearance comes. That is known as caseous necrosis. And now MCQ के लिए क्या? ये सब तो short note था. MCQ comes, caseous necrosis is coagulative, liquefactive or both. And what do you mark? Like all of you, like Dr. Gautam said, it's a mixture of both. But if they say no option as both and they say select one, it is more commonly what? So remember, caseous necrosis is more commonly coagulative necrosis. Caseous necrosis is more commonly. एक आंसर select करना है तो more commonly coagulative. Are we okay with the short note on caseous necrosis? Because now I can go on to the fourth necrosis, which is common sense वाली बात है. मतलब ये अगर सोच के गलत करा तो मतलब you are overthinking, जान के गलत कर रहे हो. The fourth one is fat necrosis. You tell me. Necrosis means death and fat means fat. तो यहाँ पे fat का death हो रहा है. Before I go to that, ऐसा क्यों है? What did you ask me regarding what? मोर कॉमन नहीं, वो तो डॉक्टर आयशी दैट इज इन टर्म्स ऑफ मैकेनिज्म वाइज. मतलब हमने मैकेनिज्म पढ़ा था ना, लिक्विफैक्टिव में तो वो पस बनता है एंड कोएगुलेटिव में प्रोटीन्स का डीनेचरेशन होता है. सो बेसिकली केशियस नेक्रोसिस में वी सॉ कि ये जो चीज अपीयरेंस लग रहा है वो मैकेनिज्म वाइज कोएगुलेटिव की तरह ज़्यादा है. मैकेनिज्म वाइज इट्स मोर ऑफ डीनेचरेशन ऑफ प्रोटीन्स दैन पस फॉर्मेशन. एक्चुअली इट्स अ लिटिल बिट ऑफ बोथ, बट ज़्यादा क्या होता है? डीनेचरेशन ऑफ प्रोटीन्स. ओके, क्लियर हो गया. अब आगे चले. नाउ वी आर गोइंग टू फैट नेक्रोसिस. फैट इज डाइंग. इसमें तो मैम कोई ये तो खुश होंगे, एवरीवन विल बी हैप्पी. फैट इज डाइंग. व्हाट एल्स डू यू वांट इन लाइफ? फैट शुड डाई. बट नाउ दिस इज अ डिजीज. दिस इज नॉट द फैट लॉस दैट यू आर टॉकिंग अबाउट. फैट सेल्स में डेथ हो रहा है. दैट इज अ डिजीज. सो विच ऑर्गन्स विल इट अकर इन? ऑब्वियसली जिन ऑर्गन्स में बहुत ज़्यादा फैट होता है. ब्रेस्ट में बहुत ज़्यादा फैट होता है. कॉमन सेंस. Omentum has a lot of fat. Where is omentum present? Breast तो चलो we all know. Omentum, where is omentum present? It is present around the abdominal organs. So if we in anatomy, this is how we draw the abdomen ना. तो omentum कहाँ पे होता है? Omentum is basically present around the abdominal organs, and omentum has a lot of fat as well. Now I'm saying fat में death हो रहा है. Fat is going to have death. Why? So let's assume in breast there is a patient, a female, she has come with a history of trauma. And you know, usually they don't come with a history of trauma. That is not how, this is how it's written in the book. How will the female come to you? There is a female, she says that 3 weeks ago, I was traveling in the car. I was wearing a seat belt and there was a sudden break or there was a small accident and I got forced forward. So because of that seat belt, I had a slight injury. ट्रॉमा का हिस्ट्री, चेस्ट पे ट्रॉमा आया. Maybe she will say that, oh, one day I was walking in the garden, 4 weeks ago I was walking in the garden, a group of few boys were playing football and they kicked the football very high, the football came and hit me on the chest. तो कहीं वेग सा एक कोई स्टोरी होगा वेयर देयर फीमेल विल से दैट ओ देयर वाज सम, आई रिमेंबर, या तो एक्सीडेंट था या फुटबॉल लगा, सम काइंड ऑफ ट्रॉमा हैपेंड टू माय चेस्ट. Okay, as soon as there will be history of trauma, what do you think will happen to the breast fat? Fat will break down. Trauma होगा, sudden impact, sudden pressure, the fat will break down. Go back to school, MBBS भूल जाओ, go back to 10th class, 11th class. Fat will break down into what? Fat breaks down into fatty acid. And do you remember in school we used to study something called saponification of fat? Whenever fat will break down into fatty acid, who will come and get added? Who will come and get added onto this? Calcium will come and get added. इसे क्या बोलते थे? Saponification of fat. And how does calcium look like? कैल्शियम देखने में कैसा होता है? स्कूल में वो जो चौक होता था, ब्लैक बोर्ड वाला चौक. कैल्शियम लुक्स चौकी, white in color. So now tell me, if for example, chalo, let's assume you are a surgeon, you are a breast super speciality surgeon, you specialize in breast surgeries. You were doing the surgery of breast for a female, she had a lump, you are doing a surgery. As soon as you put an incision, you put a slit incision on the breast skin, breast को open करते ही what do you expect? Yellow color का fat दिखेगा. यही expect करते हो कि breast में fat होता है, yellow color का fat दिखेगा. As soon as you put the incision, you started seeing white color areas in that fat. In that yellow, you started seeing a lot of white. What will you suspect? Okay, in the breast, the fat must have broken. Calcium आ गया होगा. That is why the fat is looking chalky white. This means this female somewhere had trauma. She has had fat necrosis. Let me give you one more example. Like you said, Dr. Aishi said greater omentum, lesser omentum. बिल्कुल. Omentum में भी fat होता है. Now let me say there is a case of acute pancreatitis. अभी all of you told me one logic कि ma'am in acute pancreatitis there is one enzyme activity that increases. Pancreas is very rich in an enzyme called lipase. So acute pancreatitis में what releases? Lipase releases. So just imagine if I draw this to be the pancreas and you are saying कि कौन सा enzyme release हो गया? Lipase release हो गया. So what will lipase do? आसपास का fat, will the fat remain intact or will the fat break down? So common sense, the lipase will cause fat breakdown. Lipase enzyme, तो यही तो करेगा. Because of lipase, there is going to be a fat breakdown. Story is the same. The fat will break down into what? Fatty acid. Fatty acid will attract what? It will attract calcium. Calcium कैसा दिखेगा? चौकी वाइट इन कलर. सो चाहे ब्रेस्ट का फैट ब्रेक डाउन करे, एंड में कैल्शियम. ओमेंटम का फैट ब्रेक डाउन करे, एंड में कैल्शियम. लॉजिक इन वन लाइन इज fat breaks into fatty acid, calcium comes and it starts looking chalky white. So now after making you a breast surgeon, I am now going to make you a GI surgeon, gastrointestinal surgeon. Now let's see real time. You are a gastrointestinal surgeon, you were doing a surgery, ये आपका patient था, ये patient का abdomen, आपने जैसे ही abdomen पे incision लगाया, you decided to open the abdomen like this. As soon as you opened the abdomen, you expected कि मुझे सिर्फ ये दिखेगा, ऐसा ना, येलो कलर का नॉर्मल फैट दिखेगा, येलो कलर का ऐसा फैट दिखेगा. एंड यू आर सीइंग, सी मोस्ट ऑफ द एरियाज आर येलो ओनली, एंड यू आर लाइक हाँ ओमेंटम है, ये तो नॉर्मल है. सडनली यू सी दैट इन द ओमेंटम इट्स नॉट ऑल येलो, देर आर सम चॉकी वाइट एरियाज ऑल्सो. Can you see this? And we will see more. ध्यान से देखोगे तो बीच में randomly you are seeing some chalky white areas. Then let's scan through. कुछ बीच में areas ऐसे आ रहे हैं which are randomly chalky white. Randomly they are looking a little whitish. As you will see, like over here, सब yellow है. These 3-4 spots to me are looking a little whitish. This is what is chalky white areas. And what are chalky white areas going to be? They are going to be calcium. Are we okay with this, guys? I have shown you the entire photo. Zoom in करके. This is chalky white. What did you say? अच्छा ये तो मैम GI surgeon थे, ये ओमेंटम था. ओमेंटम में chalky white areas दिखने लग गए अगर, तो मतलब फैट नेक्रोसिस हुआ है. क्यों हुआ होगा? बिकॉज ऑफ acute pancreatitis. These are only 2 examples. I can't give you. Fat is present everywhere in the body. So can fat necrosis occur everywhere in the body? Yes. रीजन अलग अलग होगा. ब्रेस्ट में इट वॉज बिकॉज ऑफ ट्रॉमा, ओमेंटम में इट वॉज बिकॉज ऑफ पैंक्रियाटाइटिस. लेट्स अज्यूम समवन कम्स टू यू विद फैट नेक्रोसिस ऑफ द आर्म. आर्म में भी तो फैट होता है ना, तो मे बी दैट पर्सन गॉट हिट विद अ बॉल और दैट पर्सन हैड अ बाइक एक्सीडेंट, तो यहाँ पर फैट ब्रेकडाउन हुआ, फैट ब्रेकडाउन हुआ, एंड में कैल्शियम आया, यहाँ पर क्या हो जाएगा, चौकी वाइट एरिया. सो एनी प्लेस वेयर फैट ब्रेक्स डाउन, कैल्शियम कम्स, दैट इज फैट नेक्रोसिस. सो लाइक यू सेड श्रेया, सेम चीज, कहीं पे भी फैट चलेगा. पेरी पैंक्रियाटिक फैट बोलना चाहते हो, हाँ, एज लॉन्ग एज यू यूजिंग द वर्ड फैट, it's fat necrosis. You got your answer yourself. Perfect. But now I want to ask you a question. Did I teach you that acute pancreatitis में कौन सा necrosis होता है? In case you have forgotten, brain and pancreas shows you which necrosis? Liquefactive. Now I'm teaching you that in acute pancreatitis there is also something known as फैट नेक्रोसिस. तो दोनों में क्या चल रहा है यहाँ पे? नाउ यू हैव टू बी वेरी कॉशियस व्हाट द एग्जामिनर हैज आस्क्ड यू. व्हेन आई एम टॉकिंग अबाउट पैंक्रियाटाइटिस, in pancreatitis, if they ask you what is the necrosis within the pancreas, pancreas के अंदर कौन सा necrosis होता है, that is going to be liquefactive necrosis. Pancreas के अंदर, inside is liquefactive. But if they ask you, like Dr. Shreya was asking us, that what is the necrosis in the peripancreatic fat around the pancreas, you will say, oh, pancreas will increase lipase. Lipase peripancreatic fat में क्या कराएगा? It is going to cause fat necrosis. So in the exam, please don't read case of pancreatitis and start marking. Sometime nowadays I've seen what earlier like NEET PG and MCQ exams were simple. Once upon a time, even the question paper, the university exams were simple. They used to write a short note on fat necrosis. Khatam. Now of lately I started seeing that even in short notes they have started giving you some kind of you can say 2-line, and then they want you to decipher and then write a short note. So they might say there is a patient of pancreatitis and there is a certain necrosis happening around the pancreas. Write the salient features of this necrosis. Which necrosis will you write about? Pancreatitis, necrosis around the pancreas. Which necrosis will you write a short note on? Sometime now they're doing this, they give you a 2-line history and then they say, अच्छा इसमें से आंसर बताओ और उस पे short note लिखो. Around the pancreas बोला तो fat necrosis, within the pancreas बोला तो liquefactive necrosis. Finally done. Coming to the 5th. Now the other 3 necrosis are जल्दी वाला, quick 3-4 lines. Fibrinoid necrosis. Fibrinoid necrosis is something that occurs due to antigen-antibody complex deposition. It is due to antigen-antibody complex deposition. So when I say antigen-antibody complex, let me give you some examples. तो ये तो मुझे mechanism of action तो समझ आ गया कि मैम somewhere antigen-antibody will combine, then fibrinoid necrosis will occur. But you will tell me what is fibrin? Fibrinoid मतलब fibrin जैसा, like fibrin. Do we know what's fibrin? Fibrin is present in the blood. Simple words में, have you all heard of blood clot? Blood is clotting. If you ever ask a medical student what is a blood clot, तो blood clot is nothing but fibrin clot. Blood clot में क्या होता है? Blood clot has fibrin, धागा like a thread. Exactly, you said clot. Very good. Dr. Anish says clot. So clot is nothing but made up of fibrin. Fibrin looks like threads. It looks like a dhaga. So fibrinoid means it is going to look something like fibrin, and this will be seen whenever there is antigen-antibody complex formation. So for example, it is seen in a disease. I am writing some diseases over here. Let me know how many of these have you heard of. Because firstly when I wrote, all of them have 3 alphabets. That's how I have learnt it. ये 3 alphabet वाला diseases have fibrinoid necrosis. Now let me ask you, how many of you have you heard of? I will be teaching you all of these in pathology, but for the time being, अभी के लिए what all do you know? What is PAN? It is polyarteritis nodosa. If I look a little carefully, you will get the meaning. Trust me. You don't even need to know the chapter. You tell me arteritis. Artery we know, blood vessel. आइटिस क्या होता है? इन्फ्लेमेशन. आर्टरीज में इन्फ्लेमेशन हो रहा है. पॉली, इन वन आर्टरी इज इट हैपनिंग और इन मेनी आर्टरीज इट इज हैपनिंग? मेनी आर्टरीज. Polyarteritis nodosa is a disease where there is, खुद ही बता दो, itis of the arteries, inflammation of the arteries and many arteries. Very good. That shows you fibrinoid necrosis. Coming to what is RHD. RHD is rheumatic heart disease. RHD is rheumatic हार्ट डिजीज, सम ऑफ यू नो अबाउट इट, सम ऑफ यू डोंट. रूमेटिक हार्ट डिजीज क्यों होता है? हार्ट में होता है तो लिखा है. इट इज ड्यू टू अ बैक्टीरिया and the name of that bacteria is streptococcus. So just imagine na, streptococcus must have been the antigen, and when antigen comes, what do I make? I make antibody. So there must be some antigen antibody complex. Ye antigen aaya, I made antibody complex bana. So which kind of necrosis will occur? Fibrinoid necrosis. Okay, coming to SLE, I will be teaching you SLE in some classes eventually. The SLE stands for systemic lupus erythematosus. SLE stands for systemic lupus erythematosus. This is also going to be, abhi I cannot tell you much, but what I can tell you is systemic matlab this involves 10-11 systems of your body, brain also, heart also, lungs also, liver also, spleen also. Systemic, many systems of your body are affected. एरिदमा, रेड कलर, एरिदमा मतलब रेड कलर का रैश होता है फेस के ऊपर. दिस आई विल टीच यू इवेंचुअली व्हेन वी गो टू इम्यूनोलॉजी चैप्टर. एंड HTN तो चलो, आई एम अज्यूमिंग ऑल ऑफ यू नो. हाइपरटेंशन, बट विच हाइपरटेंशन? इन मेडिसिन वी स्टडी देयर आर टू टाइप्स ऑफ हाइपरटेंशन, बिनाइन हाइपरटेंशन, मैलिग्नेंट हाइपरटेंशन. Obviously malignant hypertension ज़्यादा severe होता है. It is malignant hypertension which is actually going to show you fibrinoid necrosis. तो अभी के लिए please remember all three letter things: polyarthritis nodosa, rheumatic heart disease, systemic lupus erythematosus, hypertension. These show you which necrosis? They show you antigen antibody, मतलब fibrinoid necrosis. डॉक्टर आयशी, nodosa, nodosa मतलब कि इसमें अभी हम पढ़ेंगे when we go to blood vessel chapter, but because we will go to blood vessel chapter somewhere in January, तो I will tell you right now. Usually artery कैसा होता है? Straight, ऐसे बिल्कुल. For example, I'll just show you. It looks like this pencil. It looks like this pencil, right? It looks बिल्कुल straight like a pencil. But if I say उसके बीच में ऐसे गोला गोला नोड्यूल बन रहा है. So for example, instead of the artery looking like this, the artery has started showing me these nodules. So that is why we call it polyarthritis nodosa, because you will see when I'll teach you, छोटा छोटा nodular formation is happening in the artery. Okay, now let me show you, because you asked me, so let me show you. This is the artery that I'm talking about since such a long time, but oh no, I gave you the answer that I had to ask you. If I ask you what is this organ, सबसे पहले pathology में organ identify करो. What is this organ? This organ is a blood vessel. This organ is going to be a blood vessel. How did I identify? Because ma'am, in the world of pink and blue तक तो समझ आ रहा था pathology. I am seeing red. If I am seeing red, this has to be red blood cells. Red blood cell तो मतलब blood vessel में ही होगा. This is a photo of a blood vessel, and in this blood vessel, can everyone see this pinkish area? In this blood vessel सबको ये hair band की तरह एक pinkish area दिख रहा है. So this is a blood vessel, and in this blood vessel I can see this pink necrosis which is fibrinoid necrosis. You tell me guys कि blood vessel artery वाली disease कौन सी लग रही है? सोचो इन चारों में से. rheumatic heart disease तो heart का problem. systemic lupus erythematosus, मैम यू टोल्ड मी इसमें तो बहुत सारे systems हैं. polyarthritis nodosa is looking like it. Artery तो is going to be polyarthritis nodosa. Yes, so maybe this is a case of polyarthritis nodosa. Do you all agree with me? बस that's all. You don't want to think of further. Hypertension, hypertension कहाँ होता है? BP, blood pressure. Blood pressure increasing. Blood pressure will increase where? It will increase in the blood, in the arteries only, na? So could this also be a case of malignant hypertension? Yes. So just because over here अभी I don't have history of the patient, I just know ये एक blood vessel है. तो blood vessel could be either a case of pan or it could be a case of malignant hypertension. Telling you from where I have taken this photo, I have taken this photo from pan. So this in Robbins is actually labeled as polyarthritis nodosa. So ये भी हो गया. Now we come to the 6th and the 7th. Only 2 necrosis left, 2 lines, and then we are done. The 6th necrosis is gangrene. गैंग्रीन एक पूरा हाफ एन आवर का अलग चैप्टर है. सो राइट नाउ आई विल नॉट टीच यू दैट फुल हाफ एन आवर का शॉर्ट नोट. राइट नाउ आई विल ओनली टच अपॉन द पॉइंट्स दैट आर इंपॉर्टेंट ओवर हियर. बट बिफोर आई स्टार्ट, कैन यू टेल मी गैंग्रीन क्या है? द कलर इज इन फ्रंट ऑफ यू. आई हैव अ गैंग्रीन फुट ओवर हियर, आई हैव गैंग्रीन इंटेस्टाइन ओवर हियर. सो द कलर ऑफ गैंग्रीन इज गोइंग टू बी blackish and you enter the ward with a patient of gangrene, you will know from a distance. It is so foul smelling, blackish foul smelling tissue. So now as a resident or as an intern or as a practitioner, you should know that, for example, अगर आपका surgery ward है, your surgery ward is on the 3rd floor, you are climbing the stairs in the morning to get from the 1st floor, you will know कि आज gangrene का patient admitted है, because gangrene is so foul smelling. Why is it foul smelling? And by the way, in government hospitals, they don't, like, the common man can't use this term, na, that I have gangrene, he's never going to come to you. He's going to come to you with a very basic knowledge of, he will say sada hua tissue. That is what patient comes to you. Ask him na that what has happened to you, why are you visiting hospitals? He will say tissue सड़ गया है, पैर का tissue सड़ गया है, intestine का tissue सड़ गया है. So that is how they describe it. Because it is black in color, it is foul smelling. But why has it happened? It is due to problems in blood supply. There is a problem in the blood supply, so this is due to an alteration in the blood supply. That is what is known as gangrene. So how many types of gangrene can I see over here? What I see over here is known as dry gangrene, and you will agree with me that okay, हाँ, ये जो भी tissue है blackish है, थोड़ा dirty looking है, पर dry है, इस पे कुछ shiny wet area नहीं लग रहा. The second one that I see is going to be wet gangrene. The second one that I see is going to be wet gangrene. So now I want to ask you that who has made the diagnosis of gangrene? Am I making the diagnosis of gangrene as a pathologist by looking under the microscope? क्या ये हमने microscope में देख के diagnosis बनाया या patient को देख के diagnosis बनाया? Who is making the diagnosis? Is the surgeon going to make the diagnosis in the OPD? Or is the pathologist going to make the diagnosis in the microscope? ये तो मैम दिख ही रहा है. You don't need microscope for this. That is why they say gangrene is a clinical term. It is not a pathology term. ये एक clinical, this symbol is for diagnosis. This is a clinical diagnosis. आप patient को देख के gangrene बताओगे. You will never look under the microscope for gangrene, but you will always have a question that, ma'am, chalo, I looked at this patient, I thought dry gangrene. I looked at this patient, I thought wet gangrene. Both of them, how did I differentiate? Can you exactly mark kitna area sada hua tissue hai? Over here, can you exactly mark this line and say that okay, this much of area is dead and the other is fine? Can I say in dry gangrene, there is a line of demarcation that is present? Do you all agree with me? Exactly, I can highlight कि अच्छा इतना area is kharab, is dead, and the rest of the area is good to go. That is line of demarcation. But in wet gangrene, I can't understand. This area is looking little normal. This area is looking all sadawa, all dead. So is there LOD, line of demarcation दिख रहा है यहाँ पे in wet gangrene? Line of demarcation is not seen. But now my question comes, this was the dry, I understood. What has made this wet? Why is this looking, why does this have that shininess on its surface? Why is it shining? Because wet gangrene में the wet appearance is because of infection. इसमें infection हो जाता है, as a result of which it starts also forming pus. It's that pus liquid which is making it shine that much. So please remember, dry gangrene is just black dirty tissue, but wet gangrene is that black dirty tissue plus along with that it is going to be a lot of pus. That is why it's looking wet. तो मैम सब कुछ clinical चला. Why are you teaching us? हम तो necrosis पढ़ रहे थे. Why did you take us all the way into the world of gangrene? Because just imagine, what do you think is the treatment? Surgeon इसका क्या treatment करेगा? Do you want to keep सड़ा हुआ tissue in the body? You will ask the patient. Patient will say कि I don't want to get it treated. You will say if you keep this dirty tissue, all the tissues in your body will get सड़ा हुआ. All the tissues in your body will have gangrene. So what do? You will have to cut. You will have to amputate the foot. In this case, foot amputation is done. In this, intestine has to be cut and taken out. You will have to take out the dead tissue. And whenever you take out any tissue with surgery, whom do you send it to? You send it to the pathology lab. So as soon as you send dry gangrene to the pathologist, please remember, for the pathologist, dry gangrene is nothing but coagulative necrosis. And when you send wet gangrene to the pathologist, wet matlab pus पस कहाँ आता था? That was liquefactive necrosis for the pathologist. So please remember, is gangrene a new pathology term? नहीं, pathologist के लिए तो वही पुराना story is going on. For pathologists, dry gangrene is known as the coagulative necrosis, and wet gangrene जो पस वाला था, that had to be wet liquidy. So that is liquefactive necrosis. I hope that is okay with everyone, because finally I come to the last necrosis and this story will be done. So now you know ना, if you combine all 7, you will have such a nice short note. बीच में 1-2 पॉइंट भूल भी जाओगे, then also you will have a good 4 page का short note to write. इतने में तो long question बन जाए. That is how well we have read necrosis. I will always prepare you for a little more than short note. Why? Because I know that 100% तो no human being can remember. You will go in the exam, 10-20% everyone forgets. Even if you forget, then also you are able to fill pages. That is what I will prepare you for. So 7th one is Zenker's degeneration. This doesn't have the name necrosis. मैम अभी तक सब में necrosis था. Coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis. Zenker's degeneration doesn't have any necrosis word in it, because Zenker's degeneration is, number 1, seen in which fever? Have we all heard of typhoid? किसी को हुआ भी होगा, बाकी सबने सुना होगा. It is seen in typhoid fever. What? अच्छा, just forget all this. Typhoid में what happens to the patient? There's a lot of GI upset. Food poisoning होता है, vomitings होता है, diarrhea होता है. Simple words में it's a food poisoning. So that is what is typhoid. But please remember, some typhoid people, after few weeks, they end up having a complication. And that complication is coagulative necrosis. कहाँ का coagulative necrosis होता है? There is coagulative necrosis of the skeletal muscle. Coagulative necrosis of the skeletal muscle. इसे बोलते हैं Zenker's degeneration. This is referred to as Zenker's degeneration. So repeating once again, when I say Zenker's degeneration, what is it? Is it some new necrosis? No ma'am, ये भी पढ़ा हुआ है. Zenker's degeneration is the same, most common wala, coagulative necrosis, but the situation has changed. Which story is it seen in? It is seen in typhoid fever. And where is it seen in the body? It is seen in the skeletal muscle. So now in the exam, Viva में पूछ सकते हैं, which skeletal muscle? Can you give some examples? So it is seen in 2 muscles that you have to know. One, just think ना, typhoid, food poisoning, abdomen का problem है, तो abdomen के आसपास का skeletal muscle सोचो. It is going to be rectus abdominis and diaphragmatic muscle. So which are the 2 muscles where you get to see this? Rectus abdominis and diaphragmatic muscle where you see this. So now tell me, if I have to give all of you a summary before I go back and before we finish the cell death, necrosis हमारा सारा हो चुका है. How many types of necrosis did we put in? And now you will give me a summary. First, I told you सबसे common वाला, tell me one line, then I'm going to make you answer a few questions. MCQs, ठीक है? Coagulative necrosis सबसे common वाला होता है. Do you remember that? Yes. Next, which is the necrosis in the brain? Brain में देखा जाता है मैम. Liquefactive necrosis, very important. Which is the necrosis in any fat organ? In any fat organ, it is going to be fat necrosis. Okay. Which is the necrosis in TB? हमारी country का TB वाला necrosis, that is going to be caseous necrosis. Which is the necrosis due to antigen antibody reaction? Antigen antibody वो 3 alphabet वाला diseases, PAN, RH, DSLE, all those fibrinoid necrosis. यहाँ तक तो it was all pathology. Ma'am, then you started with clinical side. You started asking us things like clinical वाला gangrene. Then you said there are 2 types of gangrene. एक वो बिल्कुल dry वाला gangrene and the other one was wet gangrene. Clinical term. Dry gangrene for me is what? Dry gangrene for me is coagulative necrosis. Wet gangrene for me is liquefactive necrosis. Coming to the 7th one, that was the most different sounding. Zenker's degeneration. Which infection do you see Zenker's degeneration in? We see it in typhoid. And which necrosis is it actually? It is actually once again coagulative necrosis. You don't have to draw this in the exam. ये सिर्फ आपका mind map है. That okay, if I get a short note on necrosis, these are the 7 headings about which I will write 5 points of each and I will finish off my short note. Okay with everyone? So every exam now how again I'm telling you tips of how I used to learn. अभी तो all of you have learnt with me and I hope I have my fingers crossed that you will say कि हाँ मैम हमें समझ आ गया. Learning for MCQs and learning for university exam is different. MCQ में ना the answer is in front of you. You have 4 options. The answer is in front of you. You just have to select out of those 4 that which is the answer. Even if you've forgotten, you will read the options and you will remember. But when you go for your university exam, you have a blank answer sheet in front of you. You have to make the own heading. You have to make your own content. You have to write all the bullet points. You forget. Ma'am, मैंने पढ़ा तो सब था, but exam में while writing ना, I just forgot all about Caseous. I only wrote about these 6 and came. I forgot Caseous necrosis भी तो लिखना था. तो every question make a mind map. That is what I have done for you. कि अच्छा necrosis आएगा तो 7 necrosis, वहाँ पे मेरे 7 headings होने चाहिए. Examiner will also count. Has he or she written 7 headings? Has he written the entire question? बीच में अगर इनके बीच में कोई एक आधा point miss हो गया, not a matter to worry. No one will cut your marks. But if you don't write coagulative necrosis and you only write all the others and coagulative छोड़ दिया, then your marks will be cut. So always for every question, once you read a big topic, make a chota sa mind map that okay, these were the 7 headings, I have to learn these and go. Chalo, now let's get out of the world of I would say theory. MCQ प्रैक्टिस भी तो आता है ना एग्जाम में. हमने शॉर्ट नोट सारा प्रिपेयर कर लिया. अभी तक इसमें नो डिफरेंस बिटवीन कम्स, सो डोंट बी वरीड. You get a short note on necrosis, you can manage. Even if you get a long question on necrosis in your exam, you have read so much that you can manage. Now the only thing that can bother you is MCQs. तो वो भी solve करके 3 MCQs solve करो, that's it. 3, 4. Myelin figures are derived from. सोचो, what was myelin figure made up of? I only have 3 MCQs for you guys. How simple. Myelin figures are made up of, are derived from. I had studied myelin figures were phospholipid more than calcium. तो कैल्शियम तो यहाँ पे कहीं लिखा नहीं एंड फॉस्फोलिपिड भी नहीं लिखा. व्हाट डू आई सिलेक्ट? Phospholipid is what? Phospholipid comes in the cytoplasm? No. Nucleus? No. Phospholipid comes from the cell membrane. Exactly. So myelin figures are made up of phospholipid from cell membrane. That's amazing. Lengthy question also you should be ready for. And I don't know about your university, but there are couple of universities and colleges जहाँ पे practical exam में ना you get such clinical cards and there is a separate 10 to 20 mark viva for clinical cases. These are the kind of questions you can get. एक तो उसमें हिमैट के clinical cases होते हैं and sometimes there are some colleges which get clinical cases in practical over here. This is very simple. ये सब नहीं भी पढ़ा. Last line भी अगर पढ़ा, which of the following necrosis are you likely to find in the heart? Heart is a solid organ, so the solid organ will always be showing you what? Heart solid organ will always show you coagulative. But जब वाइवा में ये वाला फ्लैश कार्ड आएगा ना, they will ask you something else. What was your clinical diagnosis? सबसे पहले they will ask you clinical diagnosis क्या बनाया. So you tell me this is a case of a 61-year-old female patient who's having left-sided chest pain. Left-sided chest pain that is radiating to the left arm also. And that is radiating to the jaw. What is your clinical diagnosis? I think it is heart attack. It is a case of myocardial infarction and the pain is increasing. So they have rushed her to the hospital. Whenever you are suspecting left-sided chest pain or yes, what is it that you do for confirmation? You do cardiac enzymes and cardiac enzymes are elevated. It is pakka case of myocardial infarction. So you started giving treatment. However, on day 5 of observation, patient dies. अब रूल ऑफ एवरी हॉस्पिटल, ऐसे सडन डेथ होगा तो यू विल ऑलवेज टेक द पेशेंट इन फॉर एन ऑटोप्सी. Obviously, after talking to his near and dear ones and family, you will take their consent and then you will take that patient, that dead body will be taken for an autopsy. Autopsy में in the heart, what is the type of necrosis that you will find? It is coagulative. So जब आपका clinical case आता है ना, तो that time examiner can ask you if you have clinical cases in your exam, that is, or in your hospital or college, you can get these छोटा छोटा questions. Examiner might ask you कि death हुआ तो क्या करते हैं? Autopsy करते हैं. अच्छा, MI को confirm करने के लिए क्या करते हैं? कार्डियक एंजाइम्स करते हैं. So don't worry about such questions because when you will study these chapters with me, you will know how to approach patients also. Coming to one last question and then we are done with this topic. There is a 45-year-old female patient complains of being hit on the chest. Female patient hit on the chest by a football while passing a garden 4 weeks back. सिर्फ इतना सा पढ़ के बताओ क्या लग रहा है? Because the last point is which is the best phenomena and 4 necrosis है. Hit on the chest, मैम hit on the chest मतलब breast, female है, breast fat का death होगा. Only by reading this much I think it is fat necrosis. But let's not be overconfident. Fat necrosis में क्या deposit होता है? Calcium. And how does calcium look like? Calcium looks chalky white in color. So let us now read further what happened. This problem she had 4 weeks ago. She was hit on the chest. Initially starting में तो the breast was tender, swollen, starting में inflammation होगा, injury हुआ था, redness था, but over the weeks the pain has subsided. She now has a lump in the periareolar region and the lump is firm to hard. मतलब अगर this is how surgery के OPD के slip में हमेशा breast को ऐसे 4 quadrant में denote करते हैं. This is how the breast is denoted in whenever you have to write in your prescription. So if they are saying that she notices a lump in the periareolar region, nipple areola के आसपास, मतलब इस area के आसपास she is noticing कि कोई lump बना है. To be very honest, if I would have been the surgeon sitting in an OPD and a 45-year-old female, which is a good enough age, plus 40 plus age, and a hard lump in the breast is there, मेरा first diagnosis होता cancer. 45 की age में hard lump in the breast, any person on this planet will think of cancer. बट वेन द फीमेल, एंड ऑब्वियसली कैंसर सोचा तो क्या करोगे, सबसे पहले रेडियोलॉजी अल्ट्रासाउंड कराओगे. रेडियोलॉजी पे क्या समझ आया? कैल्शियम दिखा. कैंसर ऑल्सो शोज यू कैल्शियम. ऑल दिस आई विल टीच यू इन ब्रेस्ट कैंसर. ब्रेस्ट कैंसर के अल्ट्रासाउंड पे भी कैल्शियम दिखता है. ब्रेस्ट कैंसर का लंप इज ऑल्सो हार्ड, सो दिस कुड हैव बीन अ ब्रेस्ट कैंसर केस. बट एज सून एज शी टोल्ड मी कि ये सब हुआ आफ्टर 4 weeks ago I was having trauma, I had an accident or I was hit on the chest by a ball, and then I'm like, acha, this is not a case of cancer, this is probably the hard area is calcium, and that calcium has resulted in this lump and everything. This is a case of fat necrosis. So I'm not just preparing you for MCQs, I'm also trying to tell you कि don't be in a bias कि हमने necrosis पढ़ा तो patient को necrosis ही होगा. 45-year-old female comes to me with a hard lump in the breast, I don't think of necrosis, I think of cancer first. Necrosis comes after that when I talk to her and I find out कैसा history था, then necrosis comes to my mind. Finally, on that note, we have finished off with the first cell death, and that is what we had to do. So going all the way back, which I thought of that I will teach you. So cell death में हमें जो main cell death पढ़ना था, of course, was necrosis. The second one that we are going to go on to is going to be apoptosis. So let's get going. Are you ready or very tired or on the verge of giving up? What is the current state of mind? I know I've taught you a lot of things today. We have studied reversible cell injury, irreversible cell injury. We have studied of course the cell death ka concept. We have studied 7 types of necrosis. So I am very happy about the fact that you guys have studied a lot. So I am not going to torture you with the entire apoptosis, because entire apoptosis is easily close to a 1-hour lecture. What I'll do, I'll give you a basic of apoptosis, day 1, class 1. As I said, I'm not going to torture you to the limit so that you never return back for my class. I will only tell you that much of information कि आपको लगे कि हाँ doable था, और उतना हमारा रॉबिन से कवर भी हो गया. So I'm starting with apoptosis, and 20 minutes, whatever best we can cover, 25 minutes, 30 minutes max. Half an hour is good. Will you be able to survive for half an hour? And if we have a good speed, I think we can finish off also. Will you be able to survive with me for half an hour in apoptosis? या बिल्कुल नहीं हो पाएगा? Yes, no, maybe. What is your thought? So a quick answer on that and then we get going. Okay, so perfect. You don't have an option. You will survive. कर लेंगे मैम. Okay, great, amazing. तो apoptosis की बात करते हैं. Necrosis जो पढ़ा बस opposite करते जाओ. You studied necrosis, opposite करते जाओ, apoptosis मिल जाएगा. So now tell me, what was the inflammation status of necrosis? Necrosis का मुझे definition बताओ. Necrosis was pathological cell death associated with inflammation. So in apoptosis, will you have inflammation? No, I'm not writing abhi, I'm just telling you offhand. Necrosis में जो पढ़ा यहाँ उल्टा. Necrosis was pathological cell death with inflammation. Apoptosis will not have inflammation. Necrosis was pathological cell death. So apoptosis will be pathological and physiological. As I said, सब उल्टा चलेगा. So apoptosis, will you have inflammation? उल्टा. No ma'am, apoptosis will not have inflammation. Apoptosis will be what? Apoptosis will be both physiological and pathological, which basically means physiological मतलब normally भी होता है, and pathological मतलब disease में भी होता है. It occurs both ways. It occurs normally also and it occurs in disease. Let's find out. Definition बाद में करेंगे. अभी हम पहले examples पढ़ते हैं, वो ज़्यादा interesting है. Can you give me an example? Normally, you will be like, oh my god, I'm sitting over here, मेरे में apoptosis चल रहा है, cell death चल रहा है. अभी से नहीं, it is happening since you were in your mother's womb, in utero से चल रहा है. Please remember when you were making your organs, that is organogenesis or embryogenesis. Organogenesis or embryogenesis में there is apoptosis that happens, and anyone who knows how does that happen? That happens because just imagine you are making your as an embryo, you are in the first trimester, आपका hand formation हो रहा है. Do you think your hand was all these 5 fingers शुरू से ऐसे अलग अलग 5 fingers? No, your hand was like this. All the fingers were closed, they were fused. How did your fingers become 5 separate fingers? बीच का tissue कहाँ गया? Where did it vanish? It went away by apoptosis, cell death. So is cell death important? Yes. If just imagine if your fingers were like this and no cell death would have happened, apoptosis wouldn't have happened, we would have been born like this, fused fingers. All our fingers would have been joined, and how would we have functioned? We would have had one hand, no fingers separate. ये जो बीच का tissue गया, all of this is because of apoptosis. So example that I would give over here is during the hand formation, and I have to tell you pediatrics. Let's ask you that if there is a defect in apoptosis, if the apoptosis is defective, do you think the fingers will be separate or will they be fused fingers? There are going to be fused fingers. इसे क्या बोलते हैं? In technical term, what is fused fingers known as? It is known as syndactyly. I'll repeat it once again. Dactyly का मतलब होता है digits, fingers. Dactyly means fingers, and syn means synchronous, fused. Fused fingers is known as syndactyly. That is what we would have been born with. So thank your stars कि apoptosis हुआ. Apoptosis normally ज़रूरी है. It is important. Otherwise all of us would have been born with hands like this. All our fingers would have been fused. So this is the first example of physiological apoptosis. Second example, in menstruation, we can never forget what happens in females every month. For 5 days there is menstruation, there are menses, blood loss होता है. तो when I say blood loss होता है, तो actually what is getting lost? Is it blood only, or is it some tissue which is getting lost? It is endometrial tissue which is going to shed off. It is where we don't say कि we technically say blood loss हो रहा है, but it's not pure blood. It is the endometrial tissue which is getting shed off. Isn't that normal? Menstruation is normal, physiological. तो endometrial tissue का cell death होके गिरना, to shed off, that is totally normal. Endometrial tissue is also an example of physiological apoptosis. Now let's make you understand diseases में कहाँ कहाँ होता है. There are 2 places where you have to know. Let me ask you example number 1. Have we all heard of hepatitis? Hepatitis A, B, C, D, E, ऐसा सुना है? Hepatitis के बारे में सुना है? That is what? That is virus. That is nothing but viral hepatitis. In viral hepatitis also, I am particularly talking about hepatitis C virus. Please note, in hepatitis C virus and hepatitis matlab I am talking about hepatic liver. What bodies are formed? There is something known as council-man bodies that are formed in the liver. There are council-man bodies that are formed in liver. I have written as a formality because common sense है, hepatitis है तो liver में ही होगा. So the question that comes is, council-man bodies that are formed are seen in which hepatitis? So you will say council-man bodies are seen in viral hepatitis, especially C for C matlab hepatitis C. And council-man bodies are which kind of cell death? Are they necrosis or apoptosis? So they are apoptosis. One more disease, I don't know if you guys have heard, but skin जब पढ़ेंगे we will come to. स्किन में एक डिजीज होता है जिसका नाम होता है लाइकन प्लेनस. एनीवन बेसिक कुछ आइडिया है लाइकन प्लेनस में क्या होता है? इट्स अ स्किन डिसऑर्डर फॉर द टाइम बीइंग. आई कैन टेल यू लाइकन प्लेनस में वी सी समथिंग नोन एज कोलॉइड बॉडीज विच आर ऑल्सो नोन एज साइटॉइड बॉडीज विच आर ऑल्सो नोन एज civet bodies. I know these are very tough to learn, but if you look carefully, okay, yeah, so sure, Dr. Shumona, no worries. I thought everyone understood English. In case anyone, thank you for pointing it out. We'll use only English. I thought some of you did understand Hindi, and that's why I started off. But it's okay. Overall, the medium of the class is English only. I was assuming that everyone understood Hindi as well. But no worries, we'll continue with English. So continuing with lichen planus. For the time being, I can't go into too many details of lichen planus because skin chapter I will teach you later on. But there is a disease of the skin called lichen planus, which shows you too many of these C bodies. That is colloid bodies, cytoid bodies, civet bodies. They all mean the same. What bodies are they? What are they made up of? They are made up of apoptosis. So can I say apoptosis is all of CCCC bodies? Which are the diseases that show you apoptosis? The diseases that show you apoptosis are all the CCCC bodies. Councilman bodies are seen where? They are seen in hepatitis C. Whereas all the other, that is colloid bodies, cytoid body or civet bodies are seen where? They are seen in lichen planus. So now tell me a question. Differences. I'm not writing differences of necrosis, apoptosis. You get this as a question in your university exam. You will tell me differences and I will write right at the end. Necrosis. Difference number 1. Physiological or pathological? Necrosis was only pathological, only in diseases. Apoptosis, on the other hand, is both physiological and pathological. Number 2, a difference. Necrosis was having inflammation. Necrosis was having inflammation. Apoptosis does not have inflammation. Now, after all these examples, I can tell you the definition. Who will tell me the definition of apoptosis? Do you know there's a very funny saying that like 12 years of school life, you've forgotten everything you studied. Only one sentence that you remember is mitochondria is the powerhouse of the cell, and after that you have all 12 years of your school life seem dumped and wasted. Same way, all of your MBBS and MD curriculum, there will come a day you will start seeing patients and all these theory things you will forget. You will only remember the practical aspect. But one definition of theory that you will always remember, which all of you have started writing now only, programmed cell death. Everyone remembers this till their retirement and beyond, that apoptosis is programmed cell death. So examiners said that only programmed cell death will not suffice. We will have to change the definition. So first, I agree with all of you. This is nothing but programmed cell death, but it is now been added. It is known as caspase dependent programmed cell death. So obviously your next question will be, ma'am, programmed cell death though is okay. What is the meaning of this caspase? Please remember, caspase, if I break it down a little, can you just only focus on caspase for the time being? Can you understand that what does the word ase mean? Anyone? Any ase like lipase, protease or nuclease or caspase. Ase word means enzyme. So caspase is what? Caspase is an enzyme. Caspase is an enzyme that uses ATP. Does ATP usage occur in apoptosis? Yes. And that's the third difference of necrosis and apoptosis. In necrosis, did I teach you okay, ATP is being used? Did I teach you anything like that? I didn't. Because in necrosis, there is no ATP usage. I'm writing it over here. Difference table I will make right at the end. Right now, I'm just teaching you. Necrosis, there is no ATP usage. Necrosis, there is no ATP usage, whereas in apoptosis, there is ATP usage, but that is not how they write it in physiology. Whenever anything uses ATP, you call it active process. When something does not use ATP, you call it passive process. This means apoptosis, you tell me, is ATP being used? Yes, ATP is being used. That is why, what do you want to call it? I want to call it active process. Apoptosis is an active process, whereas necrosis, there is no ATP usage. What do you want to call it? I will call it a passive process, because sometimes in the textbooks it is written apoptosis is active, necrosis is passive, and then you're wondering what does that mean. Active process is the one where ATP is being used. So please remember, apoptosis, ATP is being used, it is referred to as active process. Necrosis, there is no ATP usage, and that is why it is going to be a passive process. Is that okay with everyone? Can we move forward? Now I will go back to the point that ATP, who is using ATP? ATP is being used by caspase. Caspase is using ATP. Caspase is an enzyme. Enzyme, ma'am, I know, always breaks something. Like phospholipase breaks phospholipid, protease breaks protein, nuclease breaks nucleus. What will caspase break? Caspase says, I will break anything, but I have one condition. I will only break after ASP. ASP means aspartic acid residues. That is the only condition Caspase has kept. Caspase says you give me any cell, I will break any cell for you. You have made a cell over here. Caspase says, हाँ हो जाएगा, I will do it. I will break every cell. I have one condition. I will first find aspartic acid, then I will break the cell. I will find aspartic acid, then I will break the cell. I will find aspartic acid, then I will break the cell. So now you've understood what ASP means. ASP means it breaks after aspartic acid residue. So you've understood caspase. Caspase is AS, means it's an enzyme. ASP means it will always break after aspartic acid residue. But what is it made up of? What is the structure of caspase? It contains cysteine residues. What is it? Which amino acid is it made up of? It is going to have cysteine residues. Is that okay with everyone? So now in the exam, you will write it in your short note, but in your MCQs also you are asked, what does the C in caspase stand for? It stands for cysteine residues. What does the ASP in caspase stand for? That it breaks after aspartic acid. And what does the A's in caspase stand for? It refers to enzyme. Caspase word, have you understood? It is going to break, but break where? After aspartic acid. So now I can complete the definition. Apoptosis is caspase dependent programmed cell death. Whatever I will teach you, it will use a lot of caspases. So we can straight away start with the mechanism of apoptosis. Now, this is the toughest part. In this chapter, if you can manage to finish off this mechanism, after that you are good to go. You have become a pro of this chapter. No one can defeat you. So listen to me very carefully. Last 10 minutes that you have to listen to me about the mechanism. There are two pathways of apoptosis. One is initiation and the other is execution. When I say initiation, is it, or you tell me, if you have to sit and study, like you decided you will read Robbins, what was the toughest part? Ma'am, how to read Robbins? Initiation of something is so difficult. Someone is saying, listen to Preeti ma'am's lecture. Someone is saying, no, you read Robbins. Someone is saying, read Father Robbins. Someone is saying, read Baby Robbins. Someone has given me some guidebook and he is saying, please read that. And I'm not able to decide. Then some people are saying Telegram is more than enough. You get everything on Telegram. I mean, starting of something is so difficult. I am not able to start because once I get to know that, okay, this I have to read, execution will become so simple. I will pick up that textbook and I will read it off. Initiation is the toughest part. So in apoptosis also, initiation, starting something is very difficult. After that, execution is very simple. So for starting apoptosis, you have two pathways. Now tell me, why are you studying? Obviously on a regular day after coming back from college, any normal person would want to either sleep or watch Netflix or roam around or go out for shopping, coffee, movie with friends. Why are you studying? What is the motivation and drive? What is the initiation in your life that you are studying? There are two reasons why you are studying. Either you have some extrinsic motivation. Someone from your family has told you that, listen, we have sent you to study. Please study in the hostel. Please don't keep loitering around here and there. You have a lot of responsibilities. You have been given a lot of pressure from outside. Extrinsic motivation, that they're constantly, your relatives are asking you, when will you become a doctor? How many years will you study? So extrinsic motivation. Second, intrinsic motivation. Intrinsic means what? You yourself also want to become a doctor. You want to become a good doctor for that matter. You want to do well for yourself, for your family, for your career, for your personal professional life. So one is intrinsic motivation and one is that extrinsic relative motivation. So these are the two motivations that apoptosis also has. One, it has initiation, it starts from outside or it starts from inside. Please remember, for initiation, we have caspase 8, 9 and 10, and for execution we have caspase 3, 6 and 7. Repeat with me. For initiation we have caspase 8, 9 and 10, and for execution we have caspase 3, 6 and 7. How did I divide it? For initiation, how many pathways are there? Outside and inside, extrinsic and intrinsic. For both of them I have 8, 9, 10, so split them. Extrinsic, out of 8, 9, 10, it is caspase 8 and 10. An intrinsic pathway uses what? Caspase 9. Students get so confused. I'll solve the confusion. Extrinsic pathway, E for 8 and X looks like Roman numeral 10. So now tell me, in the extrinsic pathway, which are the two caspases that you will use? 8 and 10. And in the intrinsic pathway, if you read it opposite, 9, which caspase will you use? You will be using caspase 9. Will you always remember this? Extrinsic pathway 8 and 10, intrinsic pathway 9. These two come under initiation. After that, you have to execute it. Executed going to be caspase 3, 6 and 7, out of which the most important caspase is going to be caspase 3. Headings are done. Now we go into details. Everyone, are you with me on this? Because I'm starting with the initiation of apoptosis, and for the initiation, I have two pathways. I'm starting with extrinsic pathways. So that is what I'm starting. I'm starting with initiation and I'm starting with the extrinsic pathway. What do you think? This pathway will start from inside the cell or outside the cell? Of course, extrinsic pathway means it will start outside the cell. So this is the cell which wants to undergo cell death. This is the cell which has to undergo apoptosis, right? And outside means there will be another cell by the name of T cell in my body. So this pathway will start. This is the apoptotic cell. This is the T cell from outside, on the outside of both of these. So for example, this is the apoptotic cell. This apoptotic cell has something called, this finger of mine is CD95. Repeating, this is the apoptotic cell. This has CD95. This is the T cell. It has something called CD95 ligand. Join ho gaya. I'll repeat it. Apoptotic cell has something called CD95, also known as FAS. That is why the T cell has something called CD95 ligand or FAS ligand. So now common sense is both of these will bind to each other. I'll repeat, apoptotic cell has CD95 or FAS, and the T cell has something called CD95 ligand or FAS ligand. One-on-one interaction occurs. Is it happening inside the cell or outside? Outside of this and outside of this. It's happening outside the cell. That is why it's extrinsic pathway, right? And now tell me, has the pathway started? No. We are studying this as how you study. How do you guys study? You tell me. Ma'am, first extrinsic motivation. My relatives keep telling me, when will you become a doctor? How much more will you study? That is my motivation right now. So first you decide, okay, I will study. You are CD95, you say, okay, I will study. My relatives are troubling me a lot. After 2 days, you think, why don't we make a group in the hostel? 4 or 5 of us will sit and study together. We will be able to study better. So then you decide, okay, let's join 2 more people. What have you done? You have done trimerization of FAS. Do we always have that thought that, oh, if 3 of us sit and study together, we will study so well? Exactly why you joined this batch also. You feel, okay, live I will meet so many people and ma'am will also be there. We will sit together. We will study something. Alone in my hostel room, I'm not going to study anything. So you decided, okay, let's make a group that is trimerization of FAS or CD95. The universe is proof of this, that when 3 friends have sat together with the thought of studying, they have done everything but studies. They have watched movie, they have made Maggie, they have spoken about all sorts of gossip in the college, but they have not studied. So these 3 decided that we will get together and then apoptosis will be done. Nothing happened. They wasted time. Do you have you experienced it? Do you as a group of 3 sit and waste all the time and do not study? And when you do not study, whom do you call next? Then you say, okay, let's call some senior. Senior will bookmark things for us. Important things in my hostel they will mark. Then these 3 people decide, we will now call FAD. FAD is that senior who will come to their rescue. Ke tum to nahi pad rahe, you guys are not studying. I will bookmark important things for you, at least you will pass. So what is FAD? FAD is known as FAS associated death domain. FAD is what? FAS associated death domain, which is simple now. Who has called FAD? Who has called FAD? This FAS has called it. So FAS associated death domain, and this senior comes and says, what are you 3 doing? I will do apoptosis for you. Don't worry. What will it convert? Tell me guys. Extrinsic pathway, which caspase? 8 and 10, right? So this FAD will say, I will convert procaspase 8 and 10 into caspase 8 and 10 for you. That is what you wanted to do, na? So the senior has done that for you. He said, tum teen to you 3 are so not studying. I will convert procaspase 8 and 10 to caspase 8 and 10 for you. Finally, you're like, oh, thank God. Thanks to the senior, my extrinsic pathway is done. Caspase has been activated. So as soon as you 3, suddenly someone will say, when he was alone, he was not studying. When he made a group of 3, then also there was no progress. Suddenly, as soon as they got this fad in their life, their apoptosis has occurred, they have started studying. Will there be one? Have you seen Three Idiots? And do you remember Chatur from the movie Three Idiots? As soon as he sees people are studying, what does he do? He goes and distracts them. Then one student of your hostel will come and say, "Inka to ho raha hai. These people are studying so well. Let me distract them. Let me tell them exam has been postponed." So who is that student who will be jealous and who will come and say, "Let's stop this entire process"? And that student is Flip. That student is Flip. So Flip says and says, okay, stop. Inhibitor. So now my question to you is, Flip is pro-apoptotic or anti-apoptotic? Flip is going to be anti-apoptotic. It stops this entire process. It says, no, 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 I will not let all these people get together and do this success party. I am going to stop it. It is anti-apoptotic. Are we all okay? I am giving you examples of studying because otherwise this pathway is very boring. With that real life correlation, you will never be able to learn it. So now forget the story and just listen to the short note. You are doing initiation of apoptosis, in which you are talking about the extrinsic pathway. Extrinsic pathway starts on the outside. This is the cell which has to die, and this is the T cell. The cell which has to die has CD95 or Fas, one molecule. T cell has CD95 ligand or Fas ligand, one-on-one interaction occurs. It is not successful. So 2 more Fas are got. This means there is trimerization of Fas. These 3 then bring a senior, that is FAD, and this FAD is going to convert the caspase 8 and 10, but who will stop this entire process? It is going to be Flip. Are we all okay with the extrinsic pathway? Because now in the same initiation, I am going to go on to the intrinsic pathway. Extrinsic clear हो गया, याद भी हो गया, yes. Intrinsic pathway, which caspase are you targeting? 9, and intrinsic means it will start inside the cell. So when I now what I'll do, I will start off with the next pathway, that is the intrinsic pathway, and over here I am going to say intrinsic means it is going to occur inside the cell. Anyone give me an example. Why would you want to kill your cell? Let's take these days example. You walk out and the air quality is very bad. After Diwali, it's been pathetic, especially in places like Delhi. Or otherwise, on a day-to-day basis, you walk out, there is ultraviolet light which is damaging you every day. So just imagine, this is a cell of yours and this is the ultraviolet light. This is the ultraviolet light and this is the cell of yours. Does ultraviolet light every day try to cause damage to you? Hota hai na? This you all agree. Do we every day land up with skin cancers? We don't, thank God. Who is saving us? This apoptosis. As soon as ultraviolet light comes on your skin and damages, do you know you have an alarm clock in your body? Those alarm clocks are referred to as stress sensors. Those alarm clocks are referred to as stress sensors. It's like an alarm clock, it starts buzzing. As soon as UV light comes and damages you, it starts buzzing. What are the names of the stress sensors? It is going to be BIM, BID, BAD, Noxa and Puma. It is going to be BIM, BID, BAD, Noxa and Puma. This is a song that you will have to sing and not just here with me. Bim, Bid, Bad, Noxa, Puma. You will sing this song every time you walk out under the sun. You will remember ma'am had said that when we walk out under the sun, ultraviolet light comes, it causes damage. Something starts buzzing in my body. That buzzing thing is what? The stress sensors. Can you all sing? Although I cannot hear you on the other side, but I hope you're singing. Bim, Bid, Bad, Noxa, Puma. Bim, Bid, Bad. It's a tongue twister. Bim, Bid, Bad, Noxa, Puma. They start buzzing, oh, damage, 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 alarm clock ringing. And then tell me, they will say, we have 2 types of things in the body. One we have is pro-apoptotic molecules, and the other one is going to be anti-apoptotic molecules. Can you tell me which one do you want to increase? Because let's see your judgment. This cell is damaged. This cell has been put with a lot of UV radiation. Do you want to keep a damaged cell in the body and land up with skin cancer after 1 year? Do you want to do that thing to yourself? Of course not. Do you want to keep this cell, or you are like, damaged hair, remove it? Of course you will say remove it, get rid of it. Please don't keep it for skin cancer. So what do you want to increase? You will say, please cause apoptosis, please remove this cell, please increase the pro-apoptotic molecules, decrease the anti-apoptotic molecules. Pro-apoptotic means they will increase apoptosis. They will increase apoptosis means they will say, oh, damaged cell, hatao, remove it, remove the cell. That is what they are doing. So now they will ask you, which are the pro-apoptotic molecules? Pro-apoptotic molecules include P53, BAX, and BCLX. Okay, so I think it might not be visible, so I'll just shift it a little up. Yes, it is going to be BCLXS. P53, BAX, BCLXS, whereas anti-apoptotic molecules are BCL2, MCL1, and BCLXL. And you must be like, oh my god, ma'am, what did you just go on writing? And we have not been able to keep pace. What all have you written? I'll give you a very easy way of learning. How will you learn what all come under pro-apoptotic and what all come under anti-apoptotic? Easier way to learning it, BCL2 has L, MCL1 has L, and BCLXS and XL में से BCLXL has L. All the molecules that have the alphabet L in it, are they pro-apoptotic, means they will increase apoptosis, or are they anti-apoptotic, means they will lower apoptosis? All the molecules with the alphabet L are going to lower apoptosis. They are all going to, very good, they are lower means they are all going to cause anti-apoptosis. Very, very important. Let's do a quick recap. I'll come back to this flowchart. Just one test for you. Where should I keep MCL1? In pro or anti? MCL1. I should keep it in L. All L alphabets are anti-apoptotic. Where should I keep P53? P53 you will keep it in pro-apoptotic. What about BAC and BAX? BAC and BAX also I will keep in pro-apoptotic. If I ask you BCL में BCL2, I will keep it in anti. If I ask you BCLXL, I will keep it in anti. Very good. But if I say BCLXS, that I will be keeping in pro-apoptotic. So remember, pro-apoptotic is BCLXS and BCLXL is going to be anti-apoptotic. So can I indirectly say that if you are asked where does the BCL family go? So BCL family is over here in the pro-apoptotic family also. BCL family is over here in the anti-apoptotic region also. So BCL family is both. Family pucha, so it is gonna be both. But if either of them is asked, then you will mark accordingly. So now coming back, whenever some ultraviolet light goes inside the cell, the alarm clock start ringing, bim bid bad noxa puma, bim bid bad noxa puma, they start ringing. They say, oh, hatao, remove it, remove this damaged cell. We can't take so much stress in our life. What do you increase? You increase the pro-apoptotic molecules. As soon as you increase the pro-apoptotic molecules, this signal, I don't have a long page, so I'm writing it like this. This signal is going to be sent to the hero of the story, that is mitochondria. This is the hero of the story, and that is mitochondria. So they ask you, who plays a pivotal role in apoptosis? Who plays a pivotal role in apoptosis? And that is going to be mitochondria, because I'll tell you what happens as soon as these factors give a signal to mitochondria that hatao, remove this damaged cell. Mitochondria will release two things. Mitochondria will release something called cytochrome C, and mitochondria will release something called SMAC and Diablo. Mitochondria will release SMAC and Diablo. That's how you have to learn it, SMAC and Diablo. And cytochrome C. Why do you think mitochondria is releasing all this? Does it want to, tell me in one word, does it want to keep the damaged cell or it wants to remove the damaged cell? Obviously, it is wanting to remove this damaged cell. So SMAC and Diablo, cytochrome C, are they pro-apoptotic or anti-apoptotic? Of course, they are going to be pro-apoptotic. SMAC and Diablo is also going to be pro-apoptotic, and cytochrome C, they have come out only so that they can remove. They want to remove the cell. So how will they remove? You are forgetting. Intrinsic pathway, which caspase were you wanting to activate? 8 and 10 you had activated from extrinsic pathway, 9 you are activating from intrinsic pathway. So cytochrome C will combine with a molecule called APAF1. What will cytochrome C do? Cytochrome C comes out of the mitochondria, combines with a molecule called APAF1. Together they are known as apoptosome. Any reason of why I have kept it as apoptosome? Because this apoptosome will now, I'll just, I think, yeah, I will have to shift myself probably a little, sorry for that. This apoptosome will do what? It will now convert your caspase. So please note, this apoptosome will now convert procaspase 9 into caspase 9. That is what it's going to do, and that is what you also wanted to do when you were talking about the intrinsic pathway. I'll repeat this once again and then I'll shift the video back to the source. So whenever there is ultraviolet light, this, I could have put this in 2-3 pages, which you will do in your exam, but then you would have lost track. I have put this entire thing in 1 page so that you know exactly what is happening in intrinsic pathway. So listen to me at the entire story. The ultraviolet light comes, the damage sensors, alarm clock start ringing, damage, alarm clock, siren starts going up, bim, bit, bad, noxa, puma. They increase the pro-apoptotic molecules, they say remove the cell. They send a signal to the mitochondria, the hero of the story. Mitochondria releases 2 things, one is SMAC and Diablo, one is cytochrome C. Cytochrome C then combines with what? It combines with APAF1. Together they are known as apoptosome, and this will then convert procaspase 9 into caspase 9, and that is precisely what all of you wanted to do. Did you want to actually convert these 2 things? I believe yes. If I go all the way back, from extrinsic pathway you wanted to convert caspase 8 and 10, and from intrinsic pathway you wanted to convert caspase 9. The tough part, initiation, is done, guys. I hope everyone agrees with me. Initiation ho gaya. Sigh of relief. Because then execution is just a teeny meeny 1 sentence. Execution says that in initiation, which caspases did you activate? Please be with me on this. Can you repeat? Which caspases did you activate? 8, 9, 10. What will they go and do? They will in turn activate caspase 3, 6 and 7. That's it. Execution done. What was execution? Execution was activation of caspase 3, 6 and 7. And if you remember, the most important caspase is caspase 3. It's a chain reaction. Tough part was activating caspase 8, 9, 10. You have done the tough part, extrinsic pathway, intrinsic pathway. Then a chain reaction will occur and they will activate caspase 3, 6, 7. Execution done. So you'll ask me, ma'am, has the cell died? And I'll be like, not yet. 2 more steps for that. This caspase 3, 6 and 7 will then go and activate, and now you will realize, oh my god, where we started from 2.5 hours back, ma'am has taken us exactly to that place. You want to kill a cell. What are the 3 backbones of a cell? Phospholipid, protein and nucleus. What will caspases go and do? They will activate those 3 enzymes and kill the cell. They will say, okay, number 1, phospholipase let us activate. Number 2, protease let us activate. And number 3, nuclease let us activate. Every time you want to kill a cell, that's what you do. Phospholipase, protease and nuclease. But the catch over here is, what you activate is endonuclease. Biochemistry. Do you guys know what is the difference between a normal nuclease and an endonuclease? Nuclease, you guys know that, okay, DNA has to be broken. So for example, if this is a DNA, you want to break a DNA, that is fine. But where do you break a DNA? Endonuclease says, I have a plan. I will break the DNA after every 180 to 200 base pairs. Cut. Or 180, let's take 180, cut. 180, cut. 180, cut. What is base pairs? I'm sure you know. A, T, C, G, all those nucleotides. After 180 base pairs, cut. 180, cut, 180, cut. So endonuclease doesn't go and cut anywhere. It cuts the DNA like this. 180, cut, 180, cut, 180, cut. As I said, such a simple thing. DNA, 180, cut, 180, cut. But pathology, hai na, they will give a big complicated name. This is also known as internucleosomal cleavage. This is also known as internucleosomal cleavage. And you're like, oh my god, ma'am, internucleosomal cleavage, such a big word. But if I ask you the 2 questions, you know it. Which enzyme causes internucleosomal cleavage? Endonuclease. And what is internucleosomal cleavage? 180, cut the DNA. 180, cut, 180, cut, 180, cut. So can I say, now the DNA will start looking like boxes. Boxes of 180, 180. Do you all agree with me? The DNA will start looking like boxes of 180, 180. Am I right in this? 180 base pair, 1 box, then 180, then 180. This will then result in something known as the step ladder pattern. Has the DNA started looking like steps? Just place this vertically. Imagine, instead of putting it like this, if I would have made the boxes like this, if I would have made it in a long manner. If I would have made it in a long manner, it would have started looking like boxes in a ladder. So means it would have started looking like this. This is 180, 180, 180. Has it started looking like a ladder? That is what is called as step ladder pattern. Now you will ask me, ho gaya ma'am, is the cell done? Phospholipase, protease, nuclease, three things you have activated. Now is the cell gone? Almost. The problem with apoptosis is that over here what happened, initially you had a very, very big cell. You had a very, very big cell like this. This was your cell and this was the nucleus. You did all that, initiation, execution, you did all of that pathway. The problem is the cell doesn't break off like this. No, it doesn't. In apoptosis, the cell is going to fall. The cell falls into small, small pieces like this. That is what is going to happen in the cell. You know guys, what I should have told you as the first line, I'm telling you as the last line. Do you know what is apoptosis? You told me programmed cell death. Let me add on to your life. Apoptosis is a Greek word, and Greek word meaning falling off. So you tell me, in this, has the cell just vanished in one go, or is it going to fall into smaller pieces? So over here, the cell is going to fall into smaller pieces, and those small pieces are known as apoptotic bodies. So just imagine, over here, little bit of cytoplasm fell off. Over here, little bit of cytoplasm fell off. Over here, little bit of cytoplasm, and in that little bit of nucleus also fell off. In the next part, little bit of cytoplasm, and let's say the mitochondria fell off. Then ribosome fell off. It's falling into small pieces, which could be the membrane, which could be organelles, which could be nucleus. It could be anything falling off. So you know, in the FMGE exam, few days or last session, one MCQ came, which I want you to answer also. Apoptotic bodies are falling pieces, okay? Does it have cell membrane? Does it have organelles? Does it have nucleus? Or does it have all of the above? What would you have answered? Membrane will fall, nucleus will fall, organelles will fall, or everything will fall? Everything will fall, because apoptosis, very good, all of the above, because apoptosis is a Greek word, and the meaning of this Greek word is going to be falling off. Exactly, it means falling off. So now just imagine, you'll say, ma'am, what a mess. You started with one cell. You wanted to kill it. Now instead of killing it, you have ended up making a bigger mess. You have ended up making small pieces of it. What a mess. Please get rid of it. You have ended up making like this, small pieces of it. How should I get rid of it? In one way. Do you know which is the hungry cell of your body? And that cell, like all of you, if your friend is giving a free party, birthday party, treat, all of you will be so happy to go there for free food. So there is one cell in your body who loves free food, just like all of us, foodie. Anywhere he gets free food, he will rush. You just have to give him a call. Give him a call, he will come. And that cell is going to be a macrophage. All of us are macrophages. We are foodies. But how will macrophage know that, oh, there are so many apoptotic bodies, we have to go and eat them? Someone will have to call macrophage and tell him that, bro, there's a lot of free food out here, please come and eat it. So this means to the macrophage, these apoptotic bodies will send something called eat me signal. These bodies will say, let's start calling the macrophage, let's start telling him that, oh, there is free food over here, come and eat us and finish off this pathway. This process of eating is known as efferocytosis. This is an update. These days you will get in your university exam a short note on what is efferocytosis. So please note, efferocytosis is that these small apoptotic bodies will send a signal to macrophage, and the macrophage will then come and engulf, and apoptosis is done. All these will be removed. So your only question here is, what are these eat me signals? What message has been sent? Like Zomato notifications you get, and those are some really, sometimes you feel as if you are in a relationship, the kind of notifications you get from Zomato. So those kind of notifications have to be sent to macrophage that, oh, are you hungry, or are you missing someone, or are you missing food? Those kind of notifications have to be sent to macrophage that please come and eat it. So there are three signals, three notifications that are sent. One, these cells start expressing something called C1q. So the first notification is C1q. The second notification is thrombospondin. They start expressing thrombospondin. And the third notification is the most important, which I will ask you from biochemistry, and that's the last part of this class today. In biochemistry, have you heard of something called phosphatidylserine? Have you heard of this? Something in biochemistry called phosphatidylserine. Phosphatidylserine in your cells, my cells, normal cells, it is PS, phosphatidylserine, is always present inside the cell. But if I have to send a notification to macrophage, I will have to bring phosphatidylserine outside the cell. Can I say what will these apoptotic cells do? They will do flipping of phosphatidylserine. That is the most important notification. As soon as phosphatidylserine comes outside, macrophage is like, oh yes, this is the notification I was waiting for. Free food is there. Attack. Attack and eat them all up. That is the eat me signal. So if I ask you what are the three eat me signals, there is C1q, there is thrombospondin, and there is flipping of phosphatidylserine. Signal is sent. This entire process of eat me signal is known as the efferocytosis. So now if by chance you say that ma'am, if it is how apoptosis abhi tak, is everyone clear? Because I want to tell you the last thing, 2 updates, and then I'll be done with today's class. So I'm going to take 1 minute of your life and I'm going to repeat apoptosis in exactly 1 minute. 60-second crash course of apoptosis that I'm going to do. Apoptosis has a mechanism which is initiation and execution. Initiation means starting apoptosis. Starting can happen by 2 pathways. Extrinsic pathway where I activated caspase 8 and 10. Intrinsic pathway where I activated caspase 9. Once initiation was done, by chain reaction I activated caspase 3, 6 and 7. As soon as caspase 3, 6 and 7 were activated, they activated the same 3 enzymes that are always activated, but this time instead of nuclease, endonuclease was activated. Endonuclease has a property 180 cut, 180 cut, 180 cut. That is what is done. That is known as internucleosomal cleavage. As a result of which, I have now ended up making small, many apoptotic bodies. These apoptotic bodies will then send an eat me signal to the macrophage. There are 3 eat me signals, C1q, thrombospondin and flipping of phosphatidylserine. Once the eat me signals are sent to the macrophage will come and will eat it. What is this process known as? This process is known as efferocytosis. Is this clear as a full mind map of what happened in apoptosis? Because I have to now give you 3-4 updates and then I'll be done with this. Update of Robbins, that has been there. This update makes no sense. Clinically it has 0 value, but it is there in Robbins, so I'm teaching you. It's a very factual update, rattawala update, nothing to do with patient. Did I just teach you pro-apoptotic molecules like P53, BACs, BCL-XS? And anti-apoptotic molecules with L, BCL2, MCL1, BCL-XL. Yaad aa raha hai? Then I told you some stress sensors, BIM, BIT, BAD, NOXA, PUMA. Did I tell you all of these? The update that has come in Robbins is, what is the structure? How do they look like? All of these, what do they look like? They have something called BH domains. As I said, this has nothing to do with patient. It is a pure mugging up thing, so don't break your head over it. Mug it up and move forward. Pro-apoptotic molecules have how many BH domains? 3. 1, 2, 3. Anti-apoptotic molecules have how many BH domains? 4. 1, 2, 3, 4. Stress sensors have how many BH domains? Only 1 BH domain, and that is by BH3. So how I have learnt it? Pro has how many alphabets? 3 alphabets. So how many BH domains? 1, 2, 3. Anti has how many alphabets? 4 alphabets. So how many BH domains? 1, 2, 3, 4. And stress sensors, if you read a little carefully, stress sensor has the word 3 in it. So which is the only BH domain that it has? It has only BH3. As I said, it's a pure mugging up knowledge. Nothing to do with patients. So you have to make a mnemonic and read it. Pro has 3 alphabets, so BH 1, 2, 3. Anti has 4 alphabets, so BH 1, 2, 3, 4. Stress sensor has 3 word in it, so it is going to be only BH3. Is this update okay? Have you learned the structure? So this is something you will fit in somewhere in your long question as an update from Robbins. Now I will teach you something that I taught you right now. What if this I'm teaching not for your university exams? This is not for your university exams, but I am also preparing you for NEET PG INI. You are reading patho, so you are reading it for everything, na? For future purpose, current purpose. So future, if you ever plan to appear and target AIIMS, INI, central institutes, these are the 3 questions in your notes that you will be studying. Number 1, if there is, you remember the last step that I taught you was efferocytosis? What if efferocytosis does not occur? If there is a defect in efferocytosis, this has been associated with a disease called SLE and cystic fibrosis. Right now, I'll be very honest, second year, this might not make a lot of sense, but when you go to your internship and you'll pick up these notes, this will make a lot of sense. That okay, that SLE and cystic fibrosis is a disease affecting the pancreas. These are because of defects in efferocytosis. Second, did I just tell you there is something called flipping of phosphatidylserine? Imagine if flipping of phosphatidylserine does not occur. Will apoptosis get completed? No. If there is a defect in the flipping of phosphatidylserine, what is that known as? That is known as Scott syndrome. Scott syndrome. Will apoptosis occur? No. Ma'am, apoptosis will then become defective. If there is a defect in flipping of PS, phosphatidylserine, Scott syndrome occurs. And finally, you will say that 1 second, ma'am, if our body has this option, that I can send signal, zomato notification to macrophage that, oh, come and eat me, why don't we use that for cancer cells? The biggest, you have read that recently India has been declared as the cancer capital of the world. Have you read that news? So all the chapters I will be focusing on cancer. Every chapter I will link to cancer because that is the way going forward. Everything has to be about cancer now. Have you ever wondered when we can make our macrophages eat everything? When we have a cancer inside us, why don't we send the same signal to macrophage and we tell macrophage that please eat cancer and get it out of our system? Have you ever thought that why don't we make cancer cells also send these notifications that send those relationships, zomato notifications, send it to macrophage, macrophage will come and eat cancer cell, problem solved, we will never have cancer. We thought like that. Cancer cell is very smart. Do you think cancer cell is going to carry eat me signal? No. Cancer cells are smart. They protect themselves. They carry something called do not eat me signals. Do not eat me signal is CD47. Cancer cell carries CD47, which is like a signal which says, I am sadawa khana. I am bad food, don't eat me. Suddenly, as soon as macrophage will receive a signal from CD47, macrophage will say, oh, this is spoiled food, this is expired food, I don't have to eat it. Can you see how smart cancer cell is? Cancer cell knew that as soon as I will enter this person's body, as soon as I will start growing in this person's body, there is one big foodie in this human being called macrophage. Macrophage will try to eat me, but cancer cell has started being smarter. Cancer cell says, why don't I put an expiry date on myself? Macrophage will think I am expired food and macrophage will not eat me. So cancer cell now starts getting something called do not eat me signal, and that expiry date that it has put on itself is CD47. Macrophage sees CD47 and says, no, I am not going to eat it. This is expired food. And that is how cancer cell is so smart, and it is not letting macrophage eat it. That is how cancer is growing in our body. This is just a basic. I will be talking more about cancer when we go to the chapter neoplasia. That is like 5, 6, 7 hours of only cancers. I will repeat it. But for the time being, if there is a defect in efferocytosis, SLE and cystic fibrosis occurs. If there is a defect in flipping of phosphatidylserine, Scott syndrome occurs. And why can't cancer cells be killed by macrophages? Because cancer cells carry do not eat me signal, which is CD47. Thank you guys. Thank you.